This is CheloniaCast, episode 38. Today we are joined by Dr. Elliott Jacobson, who is Professor Emeritus in University of Florida's College of Veterinary Medicine. Dr. Jacobson is also a diplomat of the American College for Zoological Medicine and has published over 300 different peer-reviewed papers dealing with some of his clinical findings as well as research in the veterinary medicine field with a focus on exotic species. We're really excited to talk to him today. Uh, Thanks for coming on, Dr. Jacobson.
Glad to be here.
All right, Wyatt, you want to get us started with our first question?
Yeah, give me it'd probably be better if Ken did that.
All right, Ken, you
All
want
right,
to
sure.
get us kicked off?
All right. So this is a preliminary question that we ask pretty much everyone. What first got you into turtles and tortoises?
Well, they're my interest actually is broader. Although I have a number of turtles and tortoises, I've been interested in reptiles a good portion of my life. But I actually started out with an interest in entomology, and since I grew up in an inner city environment in Brooklyn, New York, there weren't a lot of turtles or tortoises
Right.
in the wild. And so I was just attracted to living things that were around. And so my first interests were actually insects.
What type of insects were you interested in?
Oh, anything. I have still the first monarch butterfly I ever
Mm.
collected as a kid.
Oh, really?
That's framed that I
Oh,
caught
Okay.
in 1952, around there.
well, that's awesome.
Yeah.
That's an interesting start. So then you decided to go on and to get your DVM as well as a PhD, which is a lot of work, obviously, and a lot of our listeners are sort of younger and upcoming and sort of at the collegiate level. I'm sort of curious, like in the process of that, what sort of motivated you to do that, and then what were some of the setbacks or challenges, and how did you overcome them in sort of that process?
Well, I will say that it may look like my education is linear, and this followed this, and this followed this, and so on. But there were a lot of choices along the way, and actually going into academics was probably the last thing I think I would ever consider doing when I was in undergraduate school. I really had no idea of what academics was about other than going to school. And I went to a free university. I was City University of New York at the time I grew up in the 60s was a free undergraduate school. You had to be a resident of a borough in New York City, and then each borough had its own branch of what was called CUNY, the City University in New York, which had about 160,000 students. It was divided up about 5 campuses, 6 campuses. So I really had no idea how academics worked at all, other than when I was finishing up my undergraduate degree, I thought about going on into an entomology graduate program. But then my whole interest changed to reptiles, and um, and so I wound up going to New Mexico State University for my master's, and not knowing really what that was about, other than I was still in school, and my choice was either stay in college or go to Vietnam. And so that was an aspect of this that was if you were in the 60s and you were of age of being drafted, that was what where you'd wind up going.
Right.
So those they seem like choices, but they're not choices. There are a lot of things that affected those choices, so they look linear. But I had to learn about what graduate school was all about, and probably the best 2 years I spent 13 years in college. The 2 years I spent at New Mexico State University were the best because of where I lived, opportunities to go out in the field and get an idea of what field research was about. At that time, I worked with snakes for my master's, and for my PhD, I worked with mud puppies. I mean, choices, choices, especially when you're starting out, when you're young, you don't have a lot behind to really, at times, make the best choices. And so some choices work and some don't. And taking a certain amount of risk is inevitable. And so I feel fortunate that the choices that I made worked out just fine. I had two brother-in-laws that were veterinarians. I knew something about veterinary medicine. I knew I didn't want to work with domestic animals. That was one of my biggest early learning experiences. Even though we have our own dogs and cats, that wasn't really for me at all. And I knew nothing, zero, about zoological medicine, which when I was in undergraduate school as a profession didn't exist really. It was a handful of zoo veterinarians around the country, and there were no postgraduate, or graduate course in zoo medicine until the 70s, when I was out of school already. And so you're left with choices, and you try to make the best that you can. And I wanted to integrate my hobby, which was reptiles and keeping reptiles, with a profession. And so initially, when I got out of veterinary school, I looked at positions in zoos, and wound up taking a position as a wildlife veterinarian for the state of Maryland, which was an interesting 2 years of experience before I came here in Florida.
Your perspective is really interesting. We've had a few veterinarians on in the past, but not sort of the research read is really interesting, and making a career, like you said, out of it is a challenging thing to do in wildlife, and especially exotic species. So it's cool to see that that's been your pathway, and to hear that it's not really it's not a smooth road. There's a lot of bumps, and it's non-linear, as you've said. So maybe we can sort of transition into kind of the more topic specific stuff. The first thing I feel like is a good way to sort of kick things off is with colonian infectious diseases, and this is something you've done a good deal of work with, in terms of research, and I'm sure you've seen it in when you've worked on specimens. And I'm sort of curious if you could kind of broadly classify how can we think about all of the different diseases with regards to classification for turtles and tortoises, and I mean, we know about bacteria, viruses, those sort of things, but then there's the whole protozoan aspect, and how can we make sense of all of that?
Good question. Very, very difficult to answer in the time constraints. It's as I said, I mean, I've kept turtles a good part of my life, and tortoises also. And I look back at keeping them when I was a teenager, which the first big group of tortoises to come into the country were Greek tortoises, and they were very popular in starting out in the 60s. They became popular in the reptile pet trade, which had its infancy really was in the late 50s, early 60s. I know if any of you have read The Lizard King. It's a book
Yeah.
that was published a number of years ago, which really sums up much of the animal trade, the reptile trade in the 60s, late 50s and 60s. And I probably visited every single reptile dealer in New York City that was in that book. And so I was able to grow up in a pretty unique environment at the time. And so I transitioned from insects to reptiles. That happened probably in the late 50s, as more and more pet stores opened that sold reptiles. Prior to the late 50s, there was very little available in the reptile pet trade, at least where I lived. So having those pets was really important to me, because that also influenced the choices that I made. And as I said, turtles, tortoises are a part of reptiles as a group, and I look at them, as a somewhat singular group of animals, although each order is quite different, especially when you look at crocodilians, and which are basically feeding machines. It has been interesting now to look back at what I was exposed to, and also the friends that you have that affect your choices. And I knew almost no one else interested in reptiles as a kid growing up. Most of my friends were afraid of them, and so that was was always kind of amusing looking back at trying to get friends that were death of snakes to give them a desensitization program, which did not always work very well, because I often would have snakes. Oh, this never bites, and then the snake grabs my nose or something like that. And that's the number of friends that I had that wanted to, really or were interested in these animals were almost, non-existent. So um, I was very fortunate along the way to somehow keep my interest going. And then graduate school is what made the big difference. Graduate school, the most important thing that I learned out of all my years in graduate school was how to critically think, which you use in so many different ways. But I really was not, I did not learn how to critically think in undergraduate school. It just, wasn't there yet. Um, and today, the kinds of things you all get exposed to are light years ahead of what I was to in growing up.
Right. That's interesting. It's what were some of the events that sort of led to that, like in grad school, I guess, opened your mind to more kind of broader perspectives or critical thinking?
Well, one thing that was really excellent was what's called Journal Club, where a number of papers are copied and are available to check out. From there was at New Mexico State, there was a gathering place for faculty early in the morning, coffee room, and faculty would sit around the table and discuss various things, research, other things. And then we had these papers that were put out once a week or once every other week, and we would discuss them, and really get into the science of the papers. And this eventually led into becoming reviewers for journals, where you're reviewing papers a lot and get to see how other people write and how they form a discussion. And so that was all a very evolving process along the way, that I look back at, and actually it's so interesting to see how that turned out. But that critical thinking of every time you read a paper or read an article in a newspaper, or how to sort out what is real and what is not. And luckily, a lot of scientific papers for the most part are real, and there are mistakes made. People may interpret things incorrectly, or it may take years to get at the real truth of something. But science is based on building, just adding more information on a particular topic over time, and so there are lots of things that go into critical thinking, but that critical thinking can be applied to everyday politics that is going on in our country. to hard science. It just makes a really big difference. It can be very frustrating also because of misinformation that is so easy now to be passed around on the web.
Right. There's something to be said for access to information, but at the same time, the peer review process is something that it's good in terms of making sure data is in the right place. I'm working on a paper right now looking at the effects of urbanization on western pond turtles and red-eared sliders, how they affect them as well. And like actually thinking about the system and then looking at the data and trying to make sense of what you have in context of what the problem could be are two very different things. And it's hard sometimes not to be subjective about it, but you have to remain as objective as possible, which I think is important in science.
Well, I'd like to just insert something interesting with pond turtles, because we worked on a die-off of Pacific pond turtles probably in the early, maybe mid-90s or early 90s, probably early 90s. But it was the last population of, I think, a population of pond turtles was in southern Washington, and was on private land. And there's probably about 150 to 200 turtles in this population, something like that. And then they start having a die-off, and we received several here to work up. And they had an interesting disease affecting their pulmonary system, which at the time we just didn't have the tools to really get at what the cause was at that time. But what was interesting is there was a red-eared slider in this pond. And the question, is when you have a situation like that, is species A may carry something that doesn't kill it, but gives it to species B, and it does. And so outbreaks are really take a lot of detective type approach to figuring out causes and effects. And to this day, we still don't know have a handle on the cause of that disease. And all the turtles in that pond were collected, and they were dispersed to several different zoos, like Woodland Park Zoo, Tacoma Park Zoo, and eventually they were returned back to that system. And I don't know how that population of turtles has done. It's a long time now. It's over 30 years. And then I saw one other case in a pet. It was a captive Pacific pond turtle that a friend who was a pathologist received, and he sent me the slide, microscopic slide on it, and it looked exactly the same as this other disease in this population. And we still haven't determined what the cause of that is. And there are other pathogens that have now been reported for pond turtles. So when you're dealing with production, what's called production medicine, where you're producing a lot of animals in the work that I did was descriptive, describing different types of diseases in these animals and trying to identify causes. And today it's light years ahead of what I had available in academics here when I started out. Diagnostic pathology has changed by leaps and bounds with sequencing and looking at very, very specific pathogens and how they relate phylogenetically.
Okay, yeah. Right. That over time, and that you have an interesting perspective because you've seen how that's changed through the years and decades. So that's an interesting thing. One of the pathogens that's a big deal right now is the TINC. That's something I think that you've worked on a bit. And maybe you could give us we could start out with just a rundown on kind of the life cycle of that pathogen, and maybe you can explain to us what is strange about it or what's unknown.
we originally described that organism in radiated tortoises in the 90s, and working with a collection in south of here that a woman had a large collection of mostly side neck turtles, but she also had tortoises. And so we called it intranuclear coccidiosis, and someone then added tortoise to, to the name along the way in some paper, and then it became Tink, which is kind of amusing about it. And I've seen it in one semi-aquatic turtle also. So it's not purely tortoises, but it's certainly they're much more susceptible than from what we've seen with aquatic turtles.
And so you had done some of the initial work, I'm assuming using electron microscopy to look at actually how the organism was internuclear and sort of characterizing its morphology and infectivity. What can you sort of expand upon that? How did you analyze that, and what made you think it was it, or what leads you to think that it's internuclear, and why would that be necessary for the coccidia?
Well, it's a unique group of coccidia that they replicate in the nucleus, and so there's a sizable group of other intranuclear coccidia. There's at least one paper looking at reporting on intranuclear coccidiosis in free ranging lizards, I think in Louisiana. So we know that's there's an organism within that, within the coccidia group that replicates within the nucleus, and we could see that on electron microscopy. We could and we were able to pinpoint the lesions to look at. For instance, and starting out, a lot of the work that I did initially was histology, was histopathology, looking at what the lesion, or if there's a disease or lesion or agent, what it's like under the light microscope. And so taking samples then to an electron microscope really you have to have a lot of focus on a very small area of the sample to look at. Because electron microscopy, you're looking at maybe 200 cells, say, and what's called is a thin section, an ultra thin section. And so when you're looking at 200 cells, and you're looking for something very specifically within that group, of cells, you have to be able to focus into an area of the tissue that's going to yield the information that you need. So it's a there's a lot of work that goes into selecting a sample for electron microscopy, where in that sample to look at, how to handle it. It's very time consuming. It's very labor intensive, say compared to looking at genomic sequencing. Today, it's quicker to get sequencing done than maybe getting a really good electron microscopic analysis of the sample done. So it's tedious work. It's labor intensive, and that in the end, you have a picture of the supposed pathogen that you're looking for. And that picture gives you a lot of information on the morphology and the size and how the organism replicates and so on. There are a lot of different features of the biology of that organism that you use as a diagnostician to try and diagnose what you have. But when I was initially doing this work in the early 90s, PCR was still on the horizon. It wasn't yet to really unfold until later in the 90s. And the things that you can do today are light years ahead of what I was able to do in the 80s, when I spent a lot of my time here at the University of Florida searching for pathogens in these animals. So I became interested in the search for pathogens, and then you learn along the way. In order to do research, you need money, you need grants, and so on, and then how to integrate that into what you're doing, and how to get money, and how to put together a really good proposal for funding, and the whole history of funding has changed also over this period of time that I have been working with reptile disease. There was very little funding when I first started, and there's more funding today than probably ever before. But it's still very, very competitive to be able to get money to work on these big projects.
That's interesting to hear that. One other thing too about the TINC, there's some speculation it may form bradyzoites where it becomes dormant in the cell. Is that something that you think happens, or
It's,
what?
it's quite it's quite possible. The person I haven't spoke to, Mike Garner, is a pathologist that I've worked. He was a resident in pathology here at the University of Florida in the early '90s, and he went on to form a company, ZooPath, in near Seattle. And he has looked at a lot of samples, and this came up in the discussion. I don't know if they have now case material to show that. On the cases I worked on, I didn't pick that up, but it is certainly a possibility, or someone may have already identified that stage, and it hasn't been reported yet. But yeah, that's certainly a possibility. Some people believe that you never completely eliminate the infection because of those bradyzoites, and that may be in these animals. And then what triggers them? Can they be triggered to go from an inactive to an active infection, which we see in certain viruses like herpes. Herpes is pretty notorious for certain herpes going to the brain, and then just hanging out in the brain for some period of time until they get triggered to replicate again, like with herpes simplex in humans. And so a lot still to be learned about the intranuclear coccidiosis agent. There's a group in, well, let me back up and say that we had parasitologists helping us when we started working on this in the '90s, trying to identify stages of replication that you could pick up in fecal samples. And we're never, I mean, our parasitologist, who was an excellent reptile parasitologist, Ellis Greiner, who's now retired, looked at a lot of fecal samples from radiated tortoises in a collection where there was an outbreak, and couldn't, and I think he only had one case. He was able to identify a coccidian in a fecal sample of a radiated tortoise, and then lost that. He wasn't able to keep that going. And that material was eventually used up and not available for use anymore. So it's an organism that's not shed for whatever reason. I'm not sure if it's not being shed or we don't know how to pick it up properly. But there's a group in Germany that did, and they were able to get some sequencing data on it. That the tink organism has not been named, officially named. Because of the way parasitology is as a discipline, the morphology of the organism is very, very important for describing a new species of coccidia or protozoan parasites. But that morphology for publishing in parasitology journals is extremely important. And up to this group in Germany, no one had a good handle on the development of this organism in these animals. But they still have not named it. So I don't know what's going on with the naming, why it's gotten so problematic that it's still, we refer to it as, tink. And there probably are multiple variants within that group, because we had looked at some cases that looked using electron microscopy looked like they were different. They were not uniformly the same. So we felt that there could be a number of different variants of this organism in these animals, and the therapy is problematic. There's a good review of in I think ARAV. That is a roundtable discussion on intranuclear coccidiosis. I think it's out or came out a couple of months ago. But that has good information on probably the latest on treatment is discussed in that roundtable article.
Yeah, that's a great resource. Something about it that's kind of interesting too is it seems like I'd like to hear your experience on this, but certain species seem more susceptible to becoming ill from the pathogen. Why do you think that is? Why do certain species have different physiological responses?
Oh, it's a very good question, but also one that takes. I mean, there's so much different ways to discuss it. To make it simple, difference in receptors, in where the organism has to attach the cells, and those proteins on the surface of cells, they probably vary within a population and between populations. We see with all kinds of pathogens that some animals may be really good carriers, and but do not break with disease per se. But they can carry the organism and shed the organism, and we see it in all types of animals across the vertebrates spectrum, and that's why also mixed exhibits can be problematic depending upon how mixed the exhibit is and whether you're bringing something in to that is what we call subclinical. The animal's not showing any clinical disease, but is capable of shedding the organism to other species that are very susceptible. But you look at one aspect of it is surface proteins, but then there's how the cellular response. We broadly speaking, we have T cells and B cells, and T cells, all the various killer cells with various chemical protein chemicals that they're producing that may fend off infections, and another species doesn't have that. And those are, I mean, very basic things. So what makes one animal susceptible and another animal not so? We've seen that with HIV, with human immunodeficiency virus. Some people carry the virus and never break with a small part of the population, never break with clinical disease. And so there's a lot of work that has been done with that, with certain pathogens, but not that I know of with the intranuclear coccidiosis in Chelonians. You just don't have the money to pursue it. There's probably some good data, like with Mike Garner and his archive material. He has one of the best archival collections probably in the country or world, and you can get at some of those questions through his collection. But for instance, with TINC, some of the tortoises that are considered more problematic, Indian star tortoise, Sri Lankan stars, radiated tortoises, are up there on the list. But then you have to look at how many of these animals are there in captivity, and how they're handled and transferred about. And moving animals from one collection to another, just without a quarantine is really essential. And the same with TINC. That quarantine, when you're moving new animals into a collection, especially you have a very valuable collection, you reach a point at which any additional animal added to that collection poses a risk that it's, and where to make that cutoff at how long do you keep adding animals to a collection is something that has not been really looked at and discussed that that well, when to stop adding, and without adding on a whole new building and a whole new quarantine program. It's just so easy to transfer things around.
Yeah, there's a spatial aspect to that, and then there's sort of the epidemiological aspect to it as well. Like quantifying that would be interesting. You've also worked on, in terms of treatment of TINC, the pharmacokinetics of Panazeril, the drug. Maybe you could just explain kind of what the discipline of pharmacokinetics is, and sort of how you analyze how efficient a drug is in the system and how long it's in there, and what sort of you're doing there when you analyze that question.
Well, that's also a good question. That could take a long time to really have a really good discussion on it. But basically, pharmacokinetics. I mean, two major aspects of pharmacology: pharmacokinetics and pharmacodynamics. And so the kinetics has to do with uptake, distribution, elimination of a drug. So and we've done quite a few studies on different animals to look at certain drugs, but it's very spotty the way that we've been able to approach this field, because the money, again, the amount of money it takes to do a pharmacokinetic study, easily $10,000 to $20,000.
At least,
Say,
right? Yeah.
yeah, per drug, and that's with a lot of other things being paid for. For instance, with Panazeril, we worked on that drug because it's a coccidiot. Well, I'm not sure how well it's. There are drugs that are called they're static drugs, which slow down or pretty much the replication of the organism, and then there are cidal drugs, so which kill the organism itself. And so trying to work out what drug to use and at what dose is a lot of work. And so Panazeril was one drug that became available. Looking at well, in terms of the number of pharmacokinetic, again, pharmacokinetics refers to the uptake, distribution, and elimination of a drug, and dynamics refers to how that drug operates, on what molecular level does it operate, so you would have to pick a drug that at least in the literature reaches blood levels in that particular organ where the parasite is found. And so with the brain, there's a blood-brain barrier that prevents certain drugs from getting into the central nervous system, whereas other drugs can. Which drugs do we have the most information on? And so if you look at the literature for reptiles, chelonians included, you can see the certain. If we look at these drug studies over time in reptiles, we have to trace back, again, money. Where's the money coming to do that work? And as I mentioned, I had a graduate student work on enterofloxacin using the green iguana as a model, and how these dosages can vary with size and age. And she did a really good job on it. But it also shows the complexity of working in this field, coming up with a proper dose for an animal. You're studying an animal that weighs 10 kilos, and you're trying to use it in an animal weighing several hundred kilos. And those doses vary with what's called the metabolic size of the animal. And reptiles operate at about a third of the metabolic cost of a mammal of comparable size. So not so much the dynamics, but the kinetics can really, really change a lot between different species of reptiles.
Yeah, it looked like in the Panazrol, the paper that there wasn't much correlation between a lot of things. It was almost like the dose rate was sort of independent. The amount of the drug that was sort of in the blood was not really correlated with dose rate, and it seemed like there was a lot of individual specific variation.
It was, but what was important about that was showing that going from 50 milligrams to 100 milligrams per kilo resulted in blood levels that were detectable at 100 that were not at 50. So we had I think a fairly good, interpretation that that 100 was going to be more effective, and there are clinical cases where people have used 100 milligrams per kilo and have been able to clear, at least the way that they were collecting samples, were able to clear infection. But that question of bradyzoites will remain for probably for quite a while, whether these drugs are efficacious or not. But I feel that we at least came up with a dose that was producing blood levels, and without that, then if you're not producing any blood levels, you're not going to be affecting these animals or the parasites at all that are deep in tissues.
Right. That makes sense. And then so when you're dealing with sort of just in broad terms, antibiotics, antimicrobials, and trying to figure out proper dose rate across the board, you can do pharmacokinetic studies like that. But then there's also some level of you can do metabolic scaling and figure out kind of the relationship between metabolism and mass. But there's some potential pitfalls to that. Maybe you can speak on that a bit. Like how do we determine proper dosages?
You wing it. You do the best you can with the resources that you have, and understanding what the limitations are, especially if you're dealing with drugs with toxicities, that there are dose-dependent toxicities. For instance, one drug that is very popular to use in reptiles for microbial infections is ceftazidime, which is a cephalosporin that's been around since the 80s, the mid 80s, when studies were done to determine blood levels and at least in the species of snakes that we used, what was really good about this drug, it lasted for about 3 days, and so dosing was every 72 hours. Um, However, if you're working with potentially dangerous animals, such as venomous snakes, you can boost up the drug dose initially. Uh, Not having the exact data, I'm making inferences from data that we have collected, that this drug appears to be very safe. I've never seen any toxicities in a reptile from it. I've had some reptiles on ceftazidime for 6 months, and so I have somewhat arbitrarily doubled or tripled doses if I don't want to handle the animal as much. For instance, if 20 milligrams per kilogram results in blood levels that will persist for 72 hours, and I increase it to 40 or 60, then I can probably get by once a week for administering the drug in an animal that we call as fractious, that is not easy to work with. However, if you work with a drug like amikacin or gentamicin, which are in a completely different class of drugs that are called aminoglycosides, these drugs potentially are toxic to the kidney at high doses. And so you need to know the kinetics, and then also the toxicities that are inherent with some of these drugs. and trying to pick a drug that is low on the toxicity scale, such as ceftazidime, which again, from my estimation, is low, but it doesn't work against everything out there, every microbe that these animals potentially can get. And certainly not going to work against fungal infections, which require a whole another group of drugs that the animals need to be dosed with.
Yeah, the fungal infections as a whole, sort of, that's a different class of issues. That's something else that you've done some work. The fusarium was something that seems like it's sort of a big deal with giant tortoises. Curious.
Well, those you have to back up and say the diagnostics at the time were not the best when these papers came out, and we've experienced that even more recently. There was an outbreak of a fungal disease in wild pygmy rattlesnakes that were being studied by several researchers at Stetson University in Central Florida. And there was an outbreak of this fungal disease in these pygmy rattlesnakes, and it was a very wet season these animals had. They didn't have good basking areas, which are really essential for most of these snakes, and in turtles also that bask, because that affects their immune system, their basking and their body temperature. And so I had a graduate student work on this outbreak in these pygmy rattlesnakes, and worked under a classical mycologist who, many of those people were in botany or agriculture, because there are a lot of fungi that affect like tomatoes and plants in the food industry. And so the classical mycologists were often working with plants. And this is prior to having sequencing, the ability to sequence these organisms. So I think there's a lot of misidentifications in these fungi that have been reported in the literature prior to genomic sequencing.
A lot of people think too, I think, that fungi are sort of localized to external areas, but it's possible for them to infect other sort of organs. And have you seen that in sort of different places?
Yeah, we see that in various animals. Humans, we generally refer to skin or epidermal mycoses, cutaneous mycoses, referring to skin mycotic infections, versus the deep, what are called the deep mycoses, which in humans are those fungi that get into internal organs, liver, kidney, and so on. Also, pulmonary diseases, which in certain species, like in chelonians, pulmonary mycosis, probably more prevalent, or more descriptions in turtles and tortoises compared to snakes, for whatever reason. There are differences in site of infection when you go between different group tiles, which is quite interesting. But then you have to look at the husbandry of these animals, how these animals were kept. For instance, the big tortoises in zoos back in the, say, 50s or 60s were just not kept properly. They were allowed to cool down too much in the winter, and it makes them very susceptible to fungal pulmonary diseases, not being housed properly. So there's quite a bit of husbandry that goes into it, but there's a lot of misidentification. Sequencing is become all important in really identifying this organism. So, for instance, this organism that we now recognize in snakes, Ophidiomyces, prior to, say, 10 years ago, that genus didn't exist because we didn't have the tools to properly identify on a specific level what these these fungi really what group they belong to. So lots of misidentification. but also we're limited by the number of drugs that are safe. We have a fewer repertoire of safe drugs with fungal infections than we do, say, for microbial infections. So dealing with fungal infections in these animals' outbreaks is very challenging.
In terms of the external mycoses, that's something turtles specifically get quite frequently, and for shell infections and such. And I'm curious what the most effective treatment that you found for dealing with those is.
Well, I'm not the one to ask on that because I haven't worked with with therapeutics and with fungal infections in terms of setting up and doing the proper kinetic and dosing studies. There's quite a bit in the literature scattered about, and I think that there are people who are better in that field than I am. And when we look at this area of medicine overall, we talk about reptile medicine. It's just such a broad field, and within that field, there are areas. There are multiple areas of specialization. And so with the fungal diseases, what I mean, I have used drug dosages that others have come up with from the literature, but I don't have a lot of experience other than we worked on an outbreak of a fungal skin disease in a very big breeding group of leopard geckos, and what becomes really problematical when you work with these large groups of animals is just being able to dose them effectively, of getting the drug in them, of how to get the drug in them, and getting a drug in them that is safe. A lot more work has been done with amphibians and fungal skin disease because of the chytrids, which is good evidence of worldwide decline of amphibians, of certain amphibians from chytrid infections. We don't know of anything quite like that with fungi in reptiles. It's possible there's an organism called endomyces that's in turtles, and it basically punches out areas of their shell of the dermal plates. You get these big areas of that the bone gets lice, and so there's been some work I'm pretty sure it's ongoing now, coming up with the best treatment regimen for these animals. We've seen it here in Florida, but it's very sporadic. I think the facilities, such as there's one that was, I think, breeding alligator snapping turtles, maybe in Oklahoma, Midwest, somewhere in the Midwest,
Yeah.
and they had quite a few cases coming out of that I think that breeding operation. So, when you're working with captive animals, again, under these confined, conditions, it becomes very challenging. If you have to treat 200 turtles, how do you do that? How do you effectively do it? And I'll give you an example, a fungal disease that we did work on in sea turtles many years ago was a pulmonary fungal disease, and I'm not sure exactly what the main now, given what sequencing
Right.
that is needed, whether we were accurate in what we were diagnosing. But these sea turtles were anyway responsive to elevated water temperatures. That became a key feature in the outbreak. But I have not done any kinetic studies in reptiles, and there's a scattering of those about. And then trying to apply information from one species to another species is not straightforward. There's so much variation
in that. So a big thing with outbreaks, there is a density dependent feature of outbreaks, that you need a certain number of animals in a population to be able to transmit the organism from animal to animal. And so if you're working with an owner of the pet turtle with a singular problem, and they have the money to pay for treatment. For instance, we had a Galapagos tortoise with a deep fungal infection in a joint space, which we've seen several large tortoises with really severe septic arthritis in limbs, and that tortoise eventually, I mean, was on. I'd have to get the medical record, but it was one of the antimycotic agents like fluconazole or itraconazole, and it was on. And the bill by the end of the year was $30,000 or something like that for this is an adult female Galapagos tortoise. But the owner was very wealthy, and money was not the issue. The issue was getting this animal better. And so it really, a lot of this type of work depends upon what a client, what is affordable to a client. And do you have one animal versus 100? I mean, how do I'm saying this somewhat rhetorically, is how do you deal with 100 animals or 1,000 animals? I've had people I know that in one room have 1,000 corn snakes in plastic shoe boxes going from floor to ceiling. And when you have an outbreak in that situation versus having just one animal, very, very different on how you're going to be able to approach it. And there's a lot of experience that goes into how to best to manage an outbreak in a large collection of animals, or how do you manage an outbreak in a wild population. And I'm saying this again rhetorically because these are questions that there is no just one answer to. It depends upon the animal you're working with, and it depends upon the populations it is in, and it depends upon all the various environmental parameters that are affecting this animal's overall health, and that becomes a big issue, especially dealing with wildlife. For instance, you have desert tortoises in certain areas of the Southwest, which may only get rain a couple of times a year. And they've developed certain physiological attributes that allow them to survive in that kind of situation. But those situations compromise the overall health of these animals and make them more susceptible to other things that they may be naturally resistant to. So there's a lot of interplay that goes on here between different pathogens and the basic overall husbandry of a collection. And with fungal infections, you learn that typically treatment is longer term than with most of the bacterial infections that we encounter.
That's interesting. It's sort of it's a very complex thing, and we talked to Dr. Pete Koplis on one of the previous podcasts.
Yeah, and I know him fairly well.
Yeah, he said a lot about just how sort of exotic species as a discipline is sort of an unfair label because you're dealing with so many individual, unique species that they all have kind of their own treatment regimes and their own physiology and ecology that make them all unique. So that's something that's and it makes it challenging from a research perspective, right? Because you can only focus on so many things, and figuring out how to treat things effectively is going to be almost impossible to fully understand for everything. So you've
and a big thing is judging the overall health of the animal. When you do pick a certain therapy, of how to determine whether it's efficacious or not, and that's where a lot of experience comes in also, of how much time do you allow to occur before you have choose a different approach. And moving animals from one drug to another is not necessarily it may be good for the overall health of the animal. You start flipping around different drugs that have different effects on different components of the animal's overall health. Is something that occurs, most of the time it occurs in the background. Most of the people can't evaluate how these animals are actually improving, other than your clinical experience.
Right. Yeah. That's yeah, sort of how does the treatment, how is that affecting sort of some of it, potentially having negative effects on the animal over time too, that you have to weigh that into consideration.
Well, it is, and as I talked about previously, is what's safe, of picking drugs that are both safe and effective, and that's the balancing act.
Right. Yeah, I think that's a good overview, and sort of highlights a lot of the challenges that you deal with sort of as an exotic veterinarian. And maybe we can jump back sort of maybe quickly to the protozoans. And I'm sort of curious, something that we didn't mention previously, but that's interesting to me, is there are a lot of different protozoal coccidia, or different groupings of organisms, like Cryptosporidium is one of those, and Caryospora is another thing, and these things all are. When you see those infections in turtles and tortoises, are you seeing different clinical signs of infection, or are all of these protozoal at sort of a large scope, and within the classifications within that, do they have pretty non-specific symptoms?
A combination of things. For instance, with Cryptosporidium in aquatic or in tortoises, that there's this people have associated this very soft shell problem in animals with in tortoises with crypto, and I've just experienced that once in a Sri Lankan neonate that I got, that eating great, doing great. Actually, I mean, we did then ultimately got diagnosed with Cryptosporidium, and there are multiple species of crypto, and the list keeps growing in terms of new species as sequencing data gets brought into the identification process. And so there are lots of different species of Cryptosporidium, and this particular little neonate tortoise had a very severe infection, duodenum, and then its shell, it was a great feeder, and it was on a good diet that other tortoise, and luckily quarantined. And I generally quarantine. I mean, quarantine to me is essential. And the longer you can quarantine, up to a certain point, but the longer the better. Most still, I think a lot of people with collections really don't adequately quarantine. And so that can make a big difference. And I generally quarantine my animals for about 6 months, and do my best to keep any kind of transmission down to as low as possible. So with tortoises, I've had tortoises that have been tissue sent to me on tortoises with very severe infections, and they may, even for a tortoise, have a really, diarrhea, very, very loose stool. That's not, typical for it should be for a healthy tortoise. And so they may show clinical signs, but they're generally not that specific. Although this soft shell, condition has been associated with that. Certainly, if you had a baby tortoise that's eating well, great diet, another tortoise in the group that's eating that diet has a very firm, hard shell, is in considered good condition, and then you have this other one that just has a real spongy. You can just almost get your two fingers together when you have a thumb on the carapace and index finger on the plastron. You can just squeeze in, and the animal has essentially no calcium being deposited into the dermal plates. So that seems to be a clinical sign associated with cryptosporidium in those animals that have the clinical disease. But there are others that the organism has been identified, but are not necessarily showing signs of illness. From my own experience, I breed Transpecos rat snakes, and I have some. I don't have a lot of snakes with color morphs, but in the Transpecos rat snakes, I have a few that are silver, albino, or so on, and some of these color morphs may be associated with an immune system that's not the best. But I had this one baby hatch from a Transpecos rat snake, hatch from a clutch of say 12 egg. One within 2 weeks stomach started swelling, which is a sign commonly seen in snakes with crypto. They'll get a very enlarged, firm stomach, and the snake's stomach started that area of the body started enlarging, and I just euthanized it. And it turned out it had a really severe infection with cryptosporidium. I went back to the parents and tested them and tested other clutch mates, and I could not figure out where that came from. I just, and I don't have a huge, I have 150 animals. It's not a huge collection. And I could not identify. So something in my collection is carrying it at some low level that I could not measure. But this one snake, and it was an albino versus a silver, a blonde silver Transpecos cross, which probably neither one has a great immune system. And so, by inbreeding, you can really cause genetic problems in your animals, and you can affect their susceptibility to different bugs. So, you look at the ball pythons, and you look at corn snakes, and how inbred they are. And it's actually amazing they don't have even more problems than they do. The first cases of cryptosporidium as a pathogen in reptiles was in a very inbred collection of corn snakes at the Baltimore Zoo and at the National Zoo in Washington in the mid-'70s. And that's the first paper that was published, I think, on crypto and the pathology of cryptosporidium in a reptile in corn snakes. The excellent paper by Brownstein and others. And since that time, we've seen crypto in most reptiles except crocodilians. I don't think there's much in the way of literature at all. I think there's one case maybe. Maybe there's something more recently. But when we were doing the second edition of our book on infectious diseases and pathology of reptiles, I think that was the only report I could find. There may be something in the last 2 years, but it's uncommon in crocodilians.
Something you mentioned about the morphs being more susceptible to different pathogens. It's kind of interesting.
Yeah, that's my guess based on my experience. I don't think there are any studies to show the immune response in different color morphs of whether ball pythons or core snakes or Transpecos rat snakes. We see, I'm not sure how comparable, say, Chelonians are in terms of inbreeding effects. You don't see that selection for color or pattern as much. I have a nephew that breeds and sells radiated tortoises, and there they select for certain categories of color that make an animal sell more than another animal that doesn't have that particular color. But overall in Chelonians, we don't see that as much as, say, in snakes. I think there's far more inbreeding that's going on probably with snakes.
It's something like that. Could you potentially make the case for that morphs are driving the evolution of some of these pathogens in a potentially a negative way?
Oh, probably so. I mean, very big thing in evolution of any group of animals is resistance to infectious agents. That's a driving force in evolution. It's a game of chess, and there are many papers published on that and in the human literature of how those immune effects and how they respond to different potential pathogens. And so if we look at, but I'm still impressed with how certain species like corn snakes, how they keep on churning out these new color morphs that drive the market. And ball pythons, even more so, because they sell for somewhat more money. How that really drives. I mean, it's a pyramid. Most of these animal breeding operations are based on these pyramids. If you're on the top and the pinnacle, coming up with a new morph, that is in demand, then you're going to make quite a bit of money. And as it becomes more and more popular, you can see the prices coming down as more and more people breed that particular color or variant. And so that whole market of the driving forces in those markets is I've only paid attention to from somewhat of a distance, because I sell at the Daytona Expo, which is the first of the expos that developed, and I breed animals to sell. And I'm very selective on who I sell to. I can afford to do that because I'm not doing this as a real business, but more of as a hobby, quote, business hobby. So I think certain species you can get away, I use that term, get away with inbreeding, and others not so. For instance, I breed indigos, Texas indigos, not Florida, not the eastern indigo, but Texas indigos and crebos, and have a sizable breeding group of those animals, and I know what they sell. I mean, I know the market on them, but there some of them, like Texas indigos, are very inbred, and you can't follow them back more than maybe 2 or 3 generations at the most. I tried getting at that information, and there are only probably a few lines of Texas indigos that are in the pet trade, and I've seen stunting even in my small little group, animals that I've raised up that are somewhat stunted, and it's probably an inbreeding effect.
Interesting. Yeah, that's something. I do some like conservation work in the conservation genetics. That's kind of a hot topic in terms of just understanding the dynamics of inbreeding and what that does. But from a medical perspective, it's interesting to think about the downstream effects that inbreeding can have, and that it can impact a lot of different things in terms of immunity to different pathogens in different ways.
And not just that. For instance, I have, like, in anesthesia, and like when I work on my snakes, and I still have access, even though I'm retired for 11 years. I have access to our clinics, and I go in, especially if I have problems of my own with my own animals. And the service that I was service chief for zoological medicine for off and on for a number of years. And things certainly have changed over the last 11 that I retired. But there, for instance, in just routine anesthesia, I still fall back on old ways of doing things, primarily because I've been, certain anesthetics, approaches to anesthesia and reptiles. I do things somewhat differently than what the service that I used to head does today. For instance, like pre-meds, giving drugs that deal with pain and inflammation and so on prior to being put on a gas anesthetic. I've lost a few of my color morphs that I attribute to drug combinations that may work fine in a wild type, but not necessarily in some of these morphs. And so I try to keep the number of drugs I put into an animal to a minimum, as much as practical to do. So, for instance, with snakes are very easy to anesthetize, even venomous snakes. They can either put in a chamber, or you can intubate a harmless snake. You can intubate them directly, put a tube right into their glottis, and what we say, bag them down. We just do bag compressions, and maybe it'll take 20 minutes to get the snake to a level of anesthesia to do a procedure. And the pre-meds may shorten that period, but I've lost several snakes now to what I attribute as multiple drug interactions going on. And so I prefer, when I bring my animals in, and I prefer not using those pre-meds. I just stay with the old way of using isoflurane if I need to do an invasive procedure, or I just use a lidocaine block if it's, getting a biopsy, a cutaneous biopsy. But I try to keep the drugs down to a minimum as much as I can. And these are experiences not based on a lot of animals. Yes, these are, it could be 1 out of 100 or 1 out of 1,000. But if you're the one, it's 100%. And so I don't have 100 animals that I've given all these pre-meds to that I can say, oh, statistically I've lost 10% or 20%. So those are decisions I make based upon my clinical experience. And a lot of veterinarians and MDs do that. Their clinical experience means a lot, and it may not be necessarily something written up in a textbook.
Right. That's a good point. So, something else that maybe we can sort of transition into viruses. You've done some work with Testudine herpes viruses, and that's an interesting group. Maybe you could talk a bit about some of the research you've done with that in sea turtles and in other species.
Well, what's interesting, especially the Chelonians, is there are more reports of herpes viruses and Chelonians, where dealing with 350 species or whatever the current number is of species of Chelonians, and it's a relatively small group of reptiles. I mean, the biggest. I mean, we have say 11,700 species described, and I expect you're familiar with the reptile database.
Yeah. Yes. Yeah.
Okay, so that's what many of us use to go with what the current status is. And when I was in graduate school, the number of reptiles described, recognized as species, was about 7,500. And that's, say, early 70s.
Right.
Because that's what was in textbooks. And today now we have the database that keeps on going, churning out, describing and accepting new species that are being described. And a lot of that has to do with sequencing. For instance, there was a salamander, there still is, it's in genus Batrachoceps in California, and it was thought to be one species, and now it's turned out to be like 20. Every mountain has a different species on it where they're found. And so a lot of the going from 7,500 in the 70s to 11,700, a lot has to do with sequencing. I mean, certainly there are brand new species that are being found, but a lot of it has to do with things that were considered sibling species that look very, very similar, but turn out to be genetically, different. So that's what accounts for a lot of the increase in the new species that are being described, and it makes it very confusing now to know exactly, if you go back in the literature, unless there's a very specific location given to where that species was found, you have no idea of what you were working with at that time. I work with mud puppies, Nectaris maculosus, very large distribution for that species. Now they're being broken up into multiple species. So what I worked with, who knows? They came from a scientific company that sold Nectaris, and I have no idea where they originated from. And unless you know the point of origin, you're at a loss. Another great example, the black rat snake group, which is called a complex. The eastern and the black rat snake is now brought up or broken up into three somewhat distinct, subgroups, genomic subgroups. But that's not the final answer. There's going to be more work done on that to really figure out the whole complexity of the black rat snake population. There are some salamanders that hybridize and form these really aberrant karyotypes, ambystamids, salamanders in the Midwest. So there's still a lot to be done to just figure out genetically the composition of these various species, and how that affects the overall physiology of those animals. You have certain animals that are grouped into the same species that are from the northern part of the range to the southern part of the range, are vastly different in their physiology. And so where do you make that separation? How do you make that separation? And that becomes, even with PCR, you look at sequencing. Okay, you say that, animal A and animal B share 90% of their genome of a very specific genes that are being used for characterizing these animals. I said, and so where do you make the separation? Is it 87% difference? Mean it's homologous if it's below 90? Is 89 mean percent homology? Mean they're distinctly different? And it's very hard to know where do you have this line that's continuous. Where do you make the cut between one species and the next? And that hasn't, I don't think, been really, to me, been I can get out of the literature that easily, where that separation is made. And so there's a lot of things, some very basic things yet to be done with these animals. So you go back to Chelonians, got 350 some odd animals, but there is still quite a bit of variability. You would think, okay, 350, how much diversity is there? It's somewhat, there's quite a bit of diversity within the Chelonians. And then you say, okay, we're going to go back to herpes virus. Herpes viruses and Chelonians. Well, there are two broad categories. We have the herpes viruses that are in the aquatic Chelonians, And then we have within the aquatic group, we can break that up into sea turtles and freshwater turtles. And then we have the tortoises. And so how these viruses can be separated out in these different groups, like within tortoises, I think there's at least 5 different genotypes now, or 6. And it gets very confusing because the names that are used in the literature aren't necessarily what they're going to be ultimately named when we have more genetic information on them.
Right.
And that just adds the complexity of it. Okay, so let's look at, the work that I have done, primarily I give the credit to my graduate students. Most laboratories, really active research laboratories, are because of the graduate students that are using those labs. Prior to, say, 2000, I had graduate students that just started getting into looking at molecular phylogeny. Around now, it's become much more routine. But at that time, it really wasn't. And only small sequences of these various viruses were determined and used diagnostically. Now they become, they're much more doable than, say, back in the late 90s. But I had a graduate student, Francesco Origi, that worked with herpes virus infection in Herman's tortoises. And we use those because they're, if you look at the herpes viruses infections, the earliest reports come out of the European literature with Hermans and Greek tortoises and then Russian tortoises. And there appear to be certain species like Russian tortoises that, the evidence suggests that Russian tortoises are carriers, and that you don't want to mix Russian tortoises with other tortoises. And then there are variants between Greeks and Hermans and susceptibility differences between these different species. And one, there may be a much higher mortality than in another. So to get back, Francesco Origi worked with one particular isolate of a herpes virus that was isolated from a Herman's tortoise, and that he put back in a small group of Herman's tortoises, and was able then to follow the infection over time. And he dissected out all the nerves in the brain of his research animals, dissected out the nerves and identified all the nerves, and then did PCR on all those nerves to identify which ones had the herpes virus and which didn't. And so this herpes virus, and I forgot which colonia, maybe colonian herpes virus 5 or 3. That's how some of them are named, just in the order at which they've been found. And so he found out that this herpes virus in a number of his tortoise got more sequestered in the brain than in other tissues in the animal's body. So these animals get infected, some recover, and the virus winds up in the brain, and they may then have a recrudescence at some point down in the future when these animals get stressed. So they can get these very long-term infections as far as the evidence shows, that they can maintain infections for quite a bit of time. And there are other organisms. There's a mycoplasma, a bacteria in desert tortoises, but it's in lots of other tortoises. That is a much more also a chronic infection, but it tends not to kill as many animals initially as the herpes. When that herpes when you have an outbreak in a collection, there is pretty widespread mortality.
That's really interesting. And there's also sort of the sea turtle varieties. How do the clinical manifestations differ between the testudinid and the the colonid varieties of herpes virus?
Well, you have to go back to what has been described in the order in which these infections were described. But the earliest there was work done, and this was at Cayman Turtle Farm, which there was really some really good information that got published. But anyway, Cayman Turtle Farm, we started working there in 1978, 79. When there was actually an outbreak of this pulmonary disease in turtles that turned out to be fungal pneumonia, and again was tied to temperature and winter temperatures. Even at Cayman Turtle Farm, got down to like 23 degrees, which affected their immune system enough that they had these outbreaks of this fungal disease. And many fungi and reptiles grow better at lower temperatures, and also may use arthropods in their life history. But anyway, back to at Cayman Turtle Farm, the very first disease that was seen as a outbreak was called gray patch disease, and that was worked on by a group of virologists at the University of Miami. Harold Haynes was one. There are several others on the papers, and they described this herpes virus in these young neonate green turtles, and these were animals that were, I think, the minimum age was they were animals that were over 56 days of age, post hatching, and under a year. That's when this particular disease, and it was a skin disease primarily that we know of. That was a skin disease, and by the time I started working on this in the late 70s, the outbreaks I don't think were as severe, and it took me a while to find some cases of gray patch, and we did. We worked up a few cases, and we had that material stored back for a long period of time. And this is pre-sequencing era. I mean, it was really a lot of it had to do with the virus in culture, and this group was able to grow out this virus to a certain degree in cell culture, but then it was lost. The original virus, that virus from the University of Miami group, either a freezer went down, or there are all kinds of things that can go wrong with and lose samples, especially if you have things frozen back in an ultra freezer. A lot of people have backup and use liquid nitrogen. They have a big, tank of liquid nitrogen for their really important samples. Because if your ultra freezer goes down, especially if it's a Friday evening, and you get an emergency call that instead of minus 70, now your freezer is minus 40. And what the hell do you do? That's a whole something else that that you don't learn about until it happens to you. And so the Miami group lost their gray patch agent. And then in the 80s, they started seeing this disease. I can't say if it was, anyway, there was a disease called LET disease, lung, eye, and trachea disease. And we worked on it initially in the early 80s and really didn't know. We were only able to identify certain parasites that are trematodes, that are blood trematodes, that we were able to identify eggs of these trematodes in the lungs, and a lot of inflammation in the lungs. We thought maybe it was due to these trematodes or trematode eggs. But as it turns out, when we worked on subsequent cases, there was a herpes virus that we identified in those turtles. And then quite a bit of research has been done on that herpes virus, whereas the gray patch agent is gone. No one has an isolate of that. So we don't know how that particular agent relates to this LET, lung, eye, and trachea disease agent. We just don't have that information. And then, of course, there's fibropapilloma, which is now recognized worldwide as a tumor that is present in sea turtles. In most of the sea turtles, this fibropapilloma has been seen in the various species. But it has a higher prevalence in green turtles, less so in loggerheads, and then less so in other species of sea turtles. We worked on that for a number of years before we finally identified a herpes virus. That was in the early 90s that we had just not recognized previously. And we had electron microscopy to back that up. And then as sequencing became more popular, so much more has been identified now, looking at various variants of this virus, and some of these variants are found in certain geographic locations of the virus. But this virus now is recognized worldwide in sea turtles, and there are some animals now that can carry this virus in what appears to be normal skin. So figuring out why certain turtles will break with this disease after they're infected with this herpes virus, and other animals may be genetically resistant. And we don't know, exactly what accounts for that difference, because in any population you don't see 100% infection. There's animals that are infected and those that are not. And what makes an animal resistant? That's a question of the ages that we're always asking with all kinds of different potential pathogens like E. coli. There are some that are very use the word pathogenic, and there are some E. coli that are not, and they differ genetically. And then turtles differ from turtle to turtle. What makes turtle A susceptible and turtle B no? So those are questions for the ages.
Yeah, especially when it comes to viruses, you think about how they sort of integrate into the host genetic architecture. So, are there certain genes or that have sort of protective capacity? That's sort of a question, but something tough to analyze.
It can be. Then it comes down to money. It's money and having a lab. The laboratory is really set up to study the immune system of reptiles. There's a lot more that has been done with amphibians. Primarily, a lot of that has to do with these worldwide outbreaks with chytrids. There's an extinction going on in amphibians that does not look very good for the future of these animals. But a tremendous amount of work. If you look at the number of publications on chytrid infections, and then look at the number of publications on any fungal disease in reptiles, or even in the herpes viruses in turtles, which probably is the top pathogen that has been worked on in turtles and tortoises. And there are more herpes viruses described in turtles and tortoises than all the other reptiles put together. And why do herpes viruses become so important in this very ancient group of animals? That we don't know.
Right. It's interesting to think about, and a lot of room for future research. So, something that you brought up brought to mind a paper, the mention of the trematodes. There was a paper that looked at some blood, the hemorrhagirins in alligator snapping turtles. And I have experience working at a study site where we saw cutaneous lesions in common snapping turtles. And I'm curious if you've ever seen that in common snapping turtles, where they get these huge masses on the head. It's not like a fiber papilloma, but it's just these kind of like welts. And I'm curious if you've ever seen that in Calidra before, or other turtles, and what the cause
No,
was.
I haven't. I've worked with them with both common alligator snapping turtles sporadically as cases come into the clinic, but there are other people here with Florida Wildlife Commission. I have long-term studies with alligator snapping turtles. Fellow Kevin Inge, who works for the commission as a biologist, he's also a reptile person. And there are several other people studying alligator snapping turtles. So I have to inquire about that. I would say the big difference is again the breeding operations that have been set up for reintroduction of alligator snapping turtles, and some of the fungal problems they've had. I know that there is a new virus. I may have there may be an abstract on it. Anyway, there's an interesting. There's been an outbreak of some an infectious disease in Florida softshell turtles, which are being aquacultured in southern Florida. But there's some infectious disease, and now there's a brand new viral group that has been identified in these animals, but they're going to have to do transmission studies to get a better handle on it. You know, when you isolate a new virus in an animal, especially if it's from a whole new group, question is this incidental? Is this an incidental finding? Because I mean, there are myriads and myriads of viruses out there that in animals and plants that do nothing. That have a pretty good parasitic relationship with the host. So when you identify a new agent, what you're looking for is there anything comparable in another? You know, is there a similar infectious agent in another animal that has similar lesions that is associated with that particular bug? Or ultimately you do transmission studies, which can be also very costly, very time consuming. And that was done with the fibropapilloma agent by Larry Herbst in the early, in the 90s, who worked here, got his PhD. He's a veterinarian who then went on for his PhD. And he worked with fibropapilloma and the herpes virus that we believe to be the causative agent of those tumors, and quite a bit of work now by others that has been done and ongoing. There's a number of large ongoing studies, and trying to sort out this thing of what makes one animal susceptible and another animal not. That's still going on, but that work is only going on because of money. Larry Herbst was able to tie in to a rehab facility in the Florida Keys that the owner was willing to invest time and money keeping these turtles, taking care of them, doing transmission studies, measuring tumor growth, a whole bunch of different things that the owner was willing, and it amounted to hundreds of thousands of dollars. If a grant was needed to do this work, if we needed to rely upon a grant from Fish and Wildlife Service or National Marine Fisheries Service, which both have work with sea turtles or cover the listing of sea turtles, and they didn't have the money to do this work. It would never have been done. And even today, those kind of studies are extremely costly. And where's that money going to come from? It just doesn't happen on its own. And in the end, you're going to have to pay for supplies and labor. And labor is the big thing. The hardest thing to get money for is the salary for a graduate student. It's much easier to get money for expendables or to a certain level equipment. But getting money to a graduate student cost per year is like $40,000 to $50,000. When you look at indirect costs and other expenses and so on, but to bring in a graduate student and labs, good labs run on graduate students, especially having at least two going, so one can transfer information to the other.
That's a really interesting insider perspective, and it probably helps explain to certain people, especially in the captive sort of hobby area, that why information is kind of vague sometimes. A lot of that has to do with, like you said, the funding, and there's no way to sort of spearhead a lot of this. So really interesting.
The most funding we ever received has been with turtles and tortoises. Second, crocodilians, a little bit. And last, which is the biggest group of reptiles, squamates. I've gotten money from, I said, some drug studies in lizards. But when you look at outbreaks of infectious disease in lizards, by far the most common are skin diseases and different squamate, and both lizards and snakes. But still, the most money has been with Chelonian sea turtles and tortoises. And for us, desert tortoises out west, working with mycoplasma, which we identified as a pathogen in these, as a potential pathogen in desert tortoises, both in captivity and in the wild, and the same with gopher tortoises. But far less money. Most of our money for gopher tortoises has come privately, and some has come from the National Science NSF. And prior to the chytrid outbreaks in amphibians, National Science Foundation put very little, if any, money into disease problems in reptiles or amphibians. If you try to get money to work on a disease in these animals, they would say, go to NIH, and NIH could care less about problems in these animals, and they say, oh, go to NSF. And it was the chytrid outbreak, I believe anyway, which was first described, I think the first papers came out in the late 90s, say 98, 97, 98. And almost at the same time, described in wild frogs in Panama, and dendrobatid frogs, and then at the National Zoo. The chytrids were almost identified at the same time in the field and in captivity. And again, look at the number. If you do a search on papers published on chytrids versus all the reptiles, I mean, it dwarfs just about everything done with reptiles. And it was at that point in time that NSF then started. It opened up a new area of funding in infectious disease ecology of infectious disease in these animals, and that made a big difference. It made a big difference, but still for reptiles overall, not as much money has become available, but most of it can be tied up in fibropapilloma and probably mycoplasmosis and herpes. Those three probably account for most of the real fundable research.
Yeah, that's both of those projects are real interesting to sort of. I'm from California. I've worked at desert tortoises quite a bit, and at the desert tortoise natural area, that was something I think one of the first areas where the mycoplasmosis was.
We had worked on that in 1989, and that was all due to a graduate student at UCLA was looking at water dynamics and desert tortoises in 3 different populations. And in 88, I think he had a number of his animals didn't emerge from burrows, and they were found dead. And in 89, a small amount of money became available through, at that time, BLM, Bureau of Land Management, to work on this die-off occurring at the DTNA. And so I went out. Actually, I was in Hawaii getting samples of tumors from green turtles in Hawaii, and flew to LA, and then worked on desert tortoises, on a completely different, issue. But I've spent quite a bit of time out there over the years doing field work. And the main biologist is Dr. Christine Berry, who has been studying these animals throughout her whole career. And she recognized that something was killing tortoises out at the DTNA. And she got a small amount of money, and we started doing work in 89 on that. Another biologist easily could have not recognized the problem for what it was. And actually, when we started working with mycoplasma in desert tortoises, I had friends, colleagues that were biologists, not veterinarians, that really didn't consider disease as an issue, as a problem in wild populations for whatever reason. They just thought it was sort of a joke that this organism had been identified, desert tortoises, and it was considered to be important. And some friends sort of chided me on that, didn't think it was significant. And that whole view of infectious disease now in the conservation of these animals is all important.
Yeah, right. And it goes back to something you said earlier too about the fact that you have to, I think, sort of the Koch's postulates have to be proven for something. It could be that whatever was occurring with the desert tortoises was something that was totally fine, but you needed someone like Dr. Berry to really look into it more, and then you see this is really a problem.
Oh yeah, that initial recognition, and then getting the money for something new that had not been done before. I mean, we got a large amount of money that came out of the Nature Conservancy out of Las Vegas to work on desert tortoises that were being translocated and relocated and taken off for private land because of development. And we got a sizable several-year grant. But when that was initially reviewed, some of the reviewers thought, especially we had a big part of this project was to develop a blood test, a serological test for determining exposure of tortoises to this new mycoplasma. And reviewers of the proposal thought we were just looking to get money to do something esoteric that really would not have any application. And as it turned out, that ELISA test was used, unfortunately, in not the proper way, but used as a means to euthanize tortoises that was turned out to be what we call seropositive for exposure to this organism. And that's not what we intended at all. It just got misused and was being used out of convenience as a way to reduce the number of desert tortoises that they had to hold at this conservation facility. All of that is shut down now. I mean, there was a big conservation facility that was funded for a number of years. The tortoises coming off of developed land in Clark County, where Las Vegas is found, was located. And that money went into establishing this conservation facility where tortoises were kept. But it also is a great place for animals to be exposed to various infectious agents, because not only did they collect desert tortoises off this land, but they also collected escaped exotic tortoises that people had as pets that escaped and wound up with these desert tortoises, such as Herman's tortoises and Russian tortoises and so on. And so what a disaster to bring in animals like that into a fairly dense facility where you could have tortoises that have been never exposed to whatever these, exotics were carrying. So it was a mess now it was all shut down several years ago. It was shut down. I'm not sure exactly what they're doing with the tortoises still being taken off the land being developed, and I think many of them were relocated to a fenced-in area outside of Las Vegas that they were monitoring over time, that Fish and Wildlife was monitoring, and that many of the tortoises that went into that facility or that enclosure were killed by coyotes.
They were taking the desert tortoises and this was probably for the land, developing the land, and then bringing them to was it temporary holding and mixing them. That's
well, they were going to eventually open up that area that was confined, especially it wasn't that whatever the interstate that goes down to Baker. Anyway, it goes right by this area, and so it's not that far from traffic, and lots of tortoises are killed by cars, and there are underground passageways that have been created for tortoises, trying to reduce that mortality. And mortality comes in so many different ways. Ravens are horrible for killing tortoises, and it's not easy to get rid of ravens. Not as easy as you think it would be, because they're a migratory bird and they're protected by Migratory Bird Act, and there are groups that fight for the protection of the ravens, and there are others that want to just get rid of them. So it's a very complex situation. But coyotes were killing a lot of the translocated animals, and maybe the barriers, the fences have been taken down. I'm not sure what the status is. Last tortoise, I generally go to the annual Desert Tortoise Council meeting, which is generally held in February, often in Las Vegas, sometimes last year was in St. George in Utah. But since COVID, I haven't gone. It's been virtual, or last year was partially virtual, partially in the flesh. And but I'll probably go back next year. So I don't know what the status of that particular area. It's a sizable tract of land, but still, it was decimated by coyotes.
That's interesting that it was shut down and everything. What was the process for developing the ELISA? What was the process for that? I mean, what is the sort of underpinning chemistry of that?
Well, what the ELISA stand for enzyme-linked immunosorbent assay, and it's colorimetric. It's ultimately based on the color change when all of your reagents line up and attach. And there are different types of ELISAs. The one we developed is called indirect ELISA, in that ultimately we're measuring antibody in a tortoise that's very specific for this particular species, Mycoplasma. And so initially we had to isolate tortoise immunoglobulin, which is called IgY, is the dominant one. We have 5 classes of antibody, mammals, at least 5. And reptiles, there are 2 major classes, and there's a third that's not that well resolved. But primarily with humans and mammals, we have IgG. In reptiles, they call that same antibody IgY. And then there's IgM, which is it's basically 5 molecules related to IgG that are attached. It's a pentamer, and whereas IgY is a monomer. And so in the immune response, you get infected with a bug the first antibody to respond generally is IgM. That's this early phase antibody that develops. And then it switches over after a period of months, weeks to months. It switches over to IgY in reptiles or IgG in mammals as the dominant antibody that may differ chemically in terms of their structure. So one is a pentamere and the other is a monomer. And so to determine exposure, you want to be able to measure that very specific antibody and exclude antibodies to all other things. And so the ELISA is based on that principle that we produced a mouse antibody that recognized tortoise antibody.
That's yeah.
And the other part of this is we use these plastic trays to do this reaction in. They're called 96 well trays, and the plate is covered with the antigen that you want to determine exposure to. So it gets covered with this mycoplasma, and then other reagents are added. And if everything lines up, you get a color change. If the antibody is there and you're measuring the antibody and it's in a certain range, then we call it seropositive. And there are multiple papers that have been published on this, on the methodology and the specificity and sensitivity of the test. And there are certain attributes of a test that that need to be within a workable range for these kinds of tests to be of value. And one attribute, one is called specificity and another is sensitivity. And specificity basically is how specific is your reagent to that particular antigen. And sensitivity is the ability of your test to pick up very small amounts. How sensitive is your test? And how specific is your test? And I will say, and this is like with COVID or with almost any kind of testing that is done, it follows the same kinds of principles. Just about no diagnostic test is 100% specific and 100% sensitive. As you increase, say, the sensitivity, the specificity goes down. So you got 100% sensitivity, you have less than 100% specificity, and vice versa. As one goes up, the other goes down. And the ideal test should probably be above, say, 90%. And there are ways to figure this out statistically. And there are curves then you can create for what is normal and what is not. And so it's always important to have controls. So we have controls from studies that we've done where we know the tortoise was negative, and we have others that we know the tortoise is positive. And we can show that the ELISA correlates with the presence of the organism of infection, and that it's seronegative when it's not infected. But so testing is there are standardized methods of establishing a reliable and recognizable serological test. And there's a whole range of different serological tests over the years that have been developed. And some are what are called gold standards. That's the test that all other tests are compared to make sure it is sensitive and specific. And we spent years doing this. And then there are other research labs that have tried to develop similar tests, but they have not worked out as well. And I'll say that we can look at the literature, and we have almost 30 years of research on this. And then because of money availability, there are people who are out there to get money, even though they may not by themselves have the credentials to do the study. They have the ability to hire people to come in and do it. And there are many examples of that. But we put together a team of people here and worked on mycoplasma as well as anyone could do over a long period of time. And there's still lots of unknowns. There are new mycoplasma still yet to be described. And some of them are less pathogenic than others. And so there's still much work to be done with that. And also, again, the immune system of the tortoises. We got different populations of tortoises that are genomically distinct. And so, that still is yet to be, uncovered. All of, say, Texas tortoises. Texas tortoises appear to be more resistant based on friends that work with them and working on sick tortoises, appear to be more resistant than desert tortoises to the mycoplasma that we identified originally from desert tortoises. So, all these things are involved and ultimately resulting in that. And, why an outbreak here and no outbreak there?
Right. That's a great explanation for sort of the ELISA test. And I'm curious, is there, I've dealt with some desert tortoises captives in the past that had mycoplasmosis, and there was some talk about a treatment that you would use to flush the bacteria out. I don't know if that's something that's...
Yeah, it is. And there's actually someone who's put together a proposal to look at it. So I don't want to talk that much about it other than Jim Jarko, who's a veterinarian in Tucson, who's worked with reptiles, tortoises his whole career, and he's in the same age group as me, and so he's been working with them 40, 50 years, and he started out as a keeper at the Columbus Zoo, and then went to vet school at Ohio State, and then went to Tucson, and has been working with reptiles since, and he's come up with he has a very short abstract published from a proceedings that I have a copy of, but I have another friend that's putting together proposals. I don't want to go into it other than there are these nasal flushes that are used because of, and they have to do with where that organism is located. For the most part, the mycoplasma is on the surface has a very close association with the surface epithelium in the olfactory, in the nasal mucosa. Tortoises, turtles, tortoises have a very large nasal cavity in front of their eyes. Two big chambers. Dorsally, it's olfactory. Eventually, it's mucus for getting rid of, just junk coming in and as they breathe. And so they have this mucus and olfactory epithelium. And the organism gets in there. It starts out at the lower parts, the more ventral parts of these chambers, and then moves up dorsally. And I think it affects their whole, ability to select the right plants to eat. And because tortoises are very selective, even on the same plant, they may choose certain leaves to eat and reject others. They're very, very, in a year, they could be eating 150 different plants. And so you look at how simple we try to make their life when we bring them into captivity. We're giving them commercial diets, or we try to get at some natural diets. For instance, I feed most of my tortoises now, primarily, especially my young ones, get a puncha. I buy prickly pear pads at a Latino store here in Gainesville that sells pads, and they some have still some thorns on them, and I'll remove all the spines if there are any spines on there, and that's what probably 50% of the diet of my baby tortoises now is a puncha, and they'll get commercial diet maybe once or twice a week. But I try to stay as more natural as I can. And we don't know what the dietary effects on the immune system of these animals. And the problem with the captive tortoises is that tortoises can live a long time with mycoplasmosis if they're being fed properly, being offered food. They will continue to eat. They may not be able to select out what they like and don't like as much as a healthy tortoise. But their diets would probably affect their immune system in all kinds of ways. But a tortoise with mycoplasmosis can live for quite a long time in captivity. In the wild is different because, as I said, probably an effect on their ability to choose the right plants, and then drought probably adds on to the difficulties they face in the wild. On top of these pathogens, they're living in this very dry world. And there's one tortoise that was found in the east of Mojave that was weighed and happened to be found right at the time of the first rain. Hadn't rained in a year. And that tortoise put on 30% increase in its body mass from drinking water.
Wow.
Which is pretty remarkable.
Yeah, that is. I was recently in Florida. We were catching musk turtles, and there was one that a female. Yeah. I was convinced she was gravid, but then she let out. I picked her up a second time about a minute and a half later, and she felt about half as heavy as she was. Just.
Well, they don't have the aquatic turtles tend not to have the bladder as big a lot. Sea turtles, but even in freshwater turtles. Their bladder isn't quite as large as a tortoise.
Right, yeah.
Whenever it rains up...
Oh, go ahead.
Yeah. Whenever it rains up in Delaware, the terrapins put on a lot of weight because they just gorge themselves on the fresh water that they can find. And it's just really funny seeing the comparison between going out when it's dry and going out after a heavy rain and seeing how much flabbier the females get. They like it. The fat will literally spill over their shells. It's hilarious.
Yeah, water. The biology of these animals tied to water is pretty amazing. What these animals can withstand, and certainly there are examples of drought in the Southwest where there have been large die-offs correlated with just lack of rain.
Yeah, that's really interesting. There's something else too that I've noticed with certain species. It seems like they'll get very swollen, distended hind limb pockets, and it's not quite edemic. It's just like they're storing water in there. I mean, do you think that could be something that's going on, or what is that?
I don't know. It's one of the limbs is where they generally store quite a bit of their fat. In the inguinal and pectoral areas. If you open up a tortoise internally, they don't deposit a lot of fat at all internally, even in heavy animals. Maybe some around the heart, but those fat pads and those near the base of their limbs is fairly prominent. But I haven't necropsied any tortoises, say that I know of that were in a drought and then had an opportunity to drink and to be able to, because those sites, it may be that there's some level of water being, but it just is an odd place for. I mean, the bladder is really the site in tortoises and they're very selective in terms of, for instance, a lot of desert plants very high, especially in a drought, very, very high in potassium. And potassium is regulated in your blood in a very narrow range. Not like sodium has has a really wide range, but you're looking at much higher. Sodium is say 130, 150 milliequivalents, and potassium is say 4 or 4.1. But you know, to go from say 4 to 5 can be lethal.
Right.
And so how do they deal with that potassium? Well, they deal with it by sequestering in their bladder. And their bladder can differentially move different ions across the bladder wall. They just don't freely move from one side of the bladder into the systemic circulation. They're highly regulated by hormones and other things. But that potassium is sequestered in the bladder, and we have good data on that. I haven't published it, and maybe one day I will. But I have a lot of when I was doing a necropsy on a desert tortoise is a whole day affair, and we got to the point where the cost of working up, because we're doing organophosphates, organochlorines, all types of micronutrients, macronutrients. A necropsy, a full necropsy with all the chemical analysis being done, is about $10,000 on a tortoise. And we learned a lot by doing that. But we were able to get the money through contracts with USGS, and still writing up papers from that data. But so they take this potassium and stick it in their bladder, and they can sequester it there. And we've had some tortoises where potassium in their bladder is 100, 150 milliequivalents, which is enough to kill a lot of animals. But they sequester it there. And when that first rain comes, they're able to flush out their bladder. And that's how they deal with potassium and drought. And there are a number of people that have worked on this. But also you have to realize the desert tortoise is at the edge of its range. Most of those animals probably evolved from populations in Mexico that eventually moved north. And there's at least one or two distinct species in Mexico. But they're from a very different type of area, from this thorn forest, which is semi-tropical to tropical, maybe 500 miles south of the border.
Yeah.
Being able to regulate these electrolytes is really the difference between living and dying.
I wonder too if they can uptake some of that into the shell, and that's something for like anoxia tolerance. They certainly can do with bicarbonate and such. I mean, is that likely?
It's possible. It's possible that I don't think anyone has. It would be a tough study to do. It can be done, but people would look at that as more esoteric than in terms of practical. I mean, we know calcium fluxes between the shell and systemic circulation, and that a lot of their calcium for the eggshell is probably ultimately coming from the plants that they're feeding on, that are high in calcium, which a puncher appears to at least be able to get good levels of calcium. So there seems to be dynamics between the dermal plates, the bone, the calcium that's in there, and systemic circulation. Whether sodium, potassium, or potassium, I just don't. I don't think anyone has done that, and I'm not. That would be a tough one to try to sort out. Whether that becomes a storage site, my gut feeling, it would have to be a salt. I mean, of some type, like potassium phosphate, or just like calcium phosphate. Like calcium is circulating as an ion, but it's also circulating as a salt, and it's tied to various proteins that are circulating. For instance, calcium, is operating. Generally you can separate out males and females on calcium, and the levels of calcium in their blood. So females having much higher calcium levels, and then especially at the time that they're producing eggs, their calcium can go up above 20 versus maybe 10 to 12 milligrams percent as in a normal range. So possible, but I think the bladder is probably a major site for ionic regulation.
Yeah, that's a really interesting perspective, and it's cool to hear that it's something going on now.
Reptile kidneys cannot concentrate urine above blood osmolarity, which is like 280 to 300 milliosmoles. They can't concentrate urine. So to get rid of salt, they need extra renal sites of salt secretion. And different reptiles have done it in different ways. Sea turtles have lacrimal glands. You wouldn't think that, just the glands around the eye, but they're pretty extensive. That Harderian lacrimal glands can get rid of all that salt that they're taking in constantly, but they do. They operate quite well. But tortoises don't have any salt glands. And so if I get to write this paper with their with all this osmolarity data that we have, I've had some of these animals. I mean, their bladder osmolarity has gone up to like 500, something inconceivable.
Wow.
In a mammal. I'm pulling that number. I'd have to look up it, but very high levels that they're able to reach, and part of that is dealing with water loss. How do you, living in a dehydrating environment, how do you protect from losing too much water? And part of it is what's called BUN, their blood urinary nitrogen, which in us is, say, 30 milligrams percent or less. And in these animals, they can get up to several hundred. And that's what maintains this osmotic gradient a lot. And especially when they're hibernating or brumating in the winter, they're generally using skeletal muscle breakdown for their needs, and you'll see their what's called a BUN be pretty high up right after they come out of hibernation or brumation, those that do brumate. So these are all parts of their physiology for surviving in a very dehydrating environment, and we can see that very broadly if we look at reptiles as a group, from aquatic reptiles to those that are totally terrestrial. Their nitrogen metabolism varies depending upon their ecology, and that's pretty well recognized and reported.
Right. So one other thing that's sort of interesting and not related to urinary tract, more the gastrointestinal anatomy. The whole sort of concept behind tortoises dealing with fruit consumption. It doesn't seem like there's a lot of research in that area. I don't know I've heard that they're hindgut fermenters, but haven't seen that really quantified anywhere.
The best paper is by Karen Yarndall, who is head of the Archie Carr Center for Sea Turtle Research, who is also a nutritionist. And she's worked on nutrition of sea turtles, or most of looking at digestibility and so on in certain populations. She studied population of green turtles in Anagua in the Bahamas since she was a graduate student. Has a huge database on feeding and feeding grounds for those animals. And she's done some digestibility studies in yellow and red-footed tortoises. And so it's probably some of the, I mean, they're older papers now, but they're still very, very good. There are some that I think, I mean, the diets do vary, between, different species. And there's some data. There's still a lot that we still don't know. The best data for a tortoise is the desert tortoise. Looking at what they feed on, and there's really, really good data on that. And I expect they're probably taking, the prickly pear fruit that I'm sure are consuming also along. But what amazes me though is how they can eat a plant with spines.
Right.
And I found spines histologically in the tongue of most of the tortoises, the desert tortoises I've worked on. I mean, they're constantly getting those foreign bodies in their tongue, and they're adapted to it. They somehow do it, and it's pretty. And here I am worrying about them getting one spine. I'm pulling out all the spines that I'm buying these supposedly spineless or reduced spine puncha for human consumption, and there's still spines in them. And I'm plucking them out.
That's fascinating. They have some sort of encapsulation or something that doesn't it doesn't affect. Okay.
Well, go ahead.
Yeah, no, go ahead. Go ahead.
Now, I was going to say what is also somewhat similar is you look at hawksbill sea turtles that have a feeding strategy of feeding on sponges, spongifery. And if you look at and I've opened up several for friends in biology who wanted to identify the sponges that they were feeding on, and you can do some of that by the morphology of the spicules. And so I was doing scanning EM on intestinal tract of hawksbill sea turtles that feed a lot on sponges. And their GI tract looks like fiberglass. There's so many spicules sticking into their gut. And the inflammatory response is almost nothing. and spicules are notoriously noxious for people getting spicules in their hands from handling sponges. And so they've evolved a system where they tolerate them, and it doesn't bother them.
Yeah, it's really incredible the immune adaptations that turtles and tortoises have. One other area before we sort of can wrap things up here that I was curious about related to viruses is ranavirus. And I know that you helped with a paper that looked at sort of proving the Koch's postulates on that. But what your experience with that virus is?
Well, others have. My former graduate school student, April Johnson, did her PhD on that. She originally was going to work with herpes virus, one that's been identified in desert tortoises, but that became problematic, and there were a number of issues. But right at the same time, we had been contacted by the Wildlife Conservation Society, had been a danger species breeding program at St. Catherine's Island, which is an island off of Georgia. It's pretty much been that part of it has been closed down. But they had populations of they had radiated tortoise population, but they had some Burmese star. I don't know if they had a plowshare at the anyway. They may have had a plowshare at the time, but anyhow, they started having a die off, and we knew that they at one time had the intranuclear coccidiosis. But as it turns out, it was this rhinovirus. And we believe in April's study, she was not able to demonstrate with the transmission from amphibians, because we believed it was coming out of from amphibians, because the Bronx Zoo had this outbreak it was at a very, very rainy season. Lots of frogs, and they actually had a picture of I think it was a Burmese star. It was either radiated Burma eating a dead frog, and so the thought was that the rhinovirus more than likely was coming out of the amphibians. And April wasn't able to demonstrate that with her study, but she was, others have. I think it's pretty convincing data showing that probably amphibians are involved in this, life history of this virus, being able to move from fishes to amphibians to certain reptiles. And it has a very broad, it infects a broad group of vertebrates. There are very few viruses that infect reptiles are known to infect other animals, especially mammals. We've seen that with West Nile virus in alligators, that can go from alligators to alligator or alligators to people. And so that has a pretty wide range, plus, gets into all types of birds. And then we have the Eastern equine encephalitis virus, Western equine. The Western equine encephalitis virus has been found to overwinter in Texas tortoises. So people thought that they may serve as a reservoir for Western equine encephalitis, but that really hasn't been, I don't think, demonstrated. But overall, there are not that many viruses that jump from one class of vertebrates to another, and rhinovirus appears to be one that can.
Yeah, that's really interesting. Are there any? This is just infectious disease in general, in terms of reptiles, where you see them prevalent in other groups or classes, but you don't see them in testudines frequently.
Again, say that again.
Any sort of just infectious diseases in general that you see in other reptiles.
In general?
Yeah, but
no, there's nothing really that I know of. This endomyces is, this fungal shell disease and systemic infections. There are some that but not. That endomyces is unique to turtles, and the mycoplasmic agassiz is unique. Also. But if you're just looking at the genus Mycoplasma, that's in a wide range of vertebrates.
Right.
Endomyces is not. That appears to be much, I think, more specific to, and I think, aquatic turtles.
So at a generic level, things are fairly broad, but then at specific level, a lot of times they're
yeah. For the most part, rhinovirus. Generally, like rhinovirus is considered a genus, and then there's the various herpes viruses. It's at the specific level that they're different. But there are some oddball pathogens in reptiles that have been described so far in reptile, but there's some that are in certain reptiles, but then in insects. And then the question is, with like commercial insects, such as crickets? Can they potentially carry things that can get into the insect, feeding lizards? These it becomes very, very complex trying to sort out the life cycles of some of these bugs, and many of them, especially the fungi, those without PCR, we were in the dark. I mean, probably the vast majority of identifications are probably misidentifications prior to PCR and sequencing. Lots of misidentifications with reptiles. There's a real interesting bug. It's called Skibsted. It's a fungus that's in snakes, and it's been seen sporadically now from both colubrids to viperids. Almost all the cases in the U.S. I think there might be one in Europe, one or two in Europe, but primarily seen in the U.S. very sporadically. And it's a very weird-looking fungus that was misidentified initially. The first paper that came out describing it was considered to be an algae that had been identified in some mammals. Very unusual infection with this algae, and as it turned out, it really is a fungus, and it was misidentified. And without PCR, that would have been impossible.
Right.
Because morphologically, histologically, it looks identical to this algae that has been seen in dogs and domestic animals, and just a hodgepodge of different animals, but no outbreaks per se. And even in snakes, it's always like one case here, one case there. It's very, very sporadic. But it's a fungus that primarily uses arthropods as their host.
That's interesting, especially because those are sort of employed in a lot of cases for captive enclosures. That could potentially be an issue if you're bringing.
Well, all the isopods that are being used to make money for people and also for cleaning up tanks. But that's open as to what those organisms are carrying.
Right. All right. Well, yeah. One thing too, I think throughout the discussion that's come up that's exciting for people coming up in sort of this field is just the whole technological innovations that have occurred in this area, and it seems like there's a lot of things. It seems like we're kind of at the cusp of understanding, and it's exciting for future research.
Well, one thing I want to make sure drive this point home is one thing is to submit a sample for a certain test. It's something else entirely different about what to do with the positive and what to do with the negative, and how to use that test for the betterment of the overall population of the animals that you're working on. And a lot of laboratories, especially when we deal with reptiles and other phylogenetically lower vertebrates, is, okay, you got a positive, what does that mean? And many of the diagnostic labs that are set up to do the diagnostic test do not have the experience in the field of how best to use or interpret that test. And that's the dilemma, is whether it's a zoo vet or exotic animal vet or a biologist or whatever, you're going to submit a sample for a test. You should work out what you're going to do if that test is positive or negative before you submit the sample. I said, we've run into a number of people that have misused tests, and unfortunately, and have euthanized animals that didn't necessarily need to be euthanized.
Right. So it's good for management groups or whoever's going to be using that to come up with a game plan prior to implementing it.
Exactly, and
Yeah.
in the zoo field and AZA, and I mean, there's infectious disease committees that have been set up. The zoo vets also. I mean, there are infectious disease committees set up to deal with very specific infectious diseases, and that's why, like these roundtables, the one that came out on Tink recently, that really provides a lot of good information. And those are reviewed. Those are reviewed before they're published. They provide some really good information that otherwise would not get out there.
Right. That's a really positive thing.
And one thing I want to say in terms of my presentation, as in many talks like this, it's easy to make mistakes when you have lots of different names floating through your mind. And I hear it on the news all the time where someone is making a comment of country A, but it's really on country B.
Right.
And because once a reporter gets going, and especially when you're doing a live, interview like this without then editing it, I will say that in a interview like this, if there's any questions about what has been said, direct them to me, and if they need to be corrected, they'll be corrected.
Definitely, yeah, and 100%. I mean, we've had a really fruitful discussion, a lot of very interesting things, and obviously, talking for a long period of time, stuff is going to get omitted or maybe confused and that sort of thing. So that's certainly.
I pull numbers out of the air. If I say 500 milliosmoles versus 300 is correct and that range is normal, but it may have been 450 or 400, but that data doesn't matter because it hasn't been published. I'm the only one that has it anyway.
Right. Well, yeah, that's a upside to that.
That is.
Yeah. Okay. Well, we could start to wrap things up. I have a few maybe rapid fire questions.
Sure. Go ahead.
Yeah, if that works. So one thing that's.
Oh, let me promote our book while we're.
Yeah, for sure.
You've seen the second edition.
I actually have put in a request for it. It's UGA library, but it's the one campus that's 4 hours away, so I have to wait about a month.
Oh, okay.
Yeah.
Well, it's an expensive 2-volume set. It's somewhere. It's from CRC Press, and it's probably $380 for the 2-volume set. There are a lot. I mean, the figures have been really white balanced and color matched. I think they're as good as any you'll find anywhere. And the first chapter is on biology, and there are certain figures there that have been published than anywhere else. And so, anyhow, it's current up to 2020. It was published in September 21. And most of the chapters were very current. I was able to edit them down to the very end. But the last 2 years are not there. And there's quite a bit of information that has come out just in the last 2 years.
That's okay. That's good to know. And then what's the name? We can, if you just want to say that, we can also put this in the description of the video so people interested can find it.
Infectious diseases and pathology of reptiles, color atlas, and text. And
Awesome.
It's co-authored myself and Dr. Michael Garner.
Awesome. Yeah, we will have that for anyone interested listening in the description of the podcast or YouTube, depending on how you're watching. So cool.
Okay.
All right, we'll go through some quick. So one of the things that is always been kind of interesting to me is the potential for volvuli or volvuluses to form in tortoises, turtles when you rotate them. And I'm curious what you think about the odds of that happening.
I think they're low. Certainly can happen. But I've taken, I have leopard tortoises and then Sri Lankan stars, small animals. And, but I've rotated them for various purposes. And I always do it very slowly in case there's an issue. And but I've had, my leopard tortoises, one of the problems I have to deal with are males knocking over females. And they push them. They I don't know why their behavior changes. They go from trying to mate them, breed them, until pushing them laterally on their lateral side, where they're able to push them enough to turn them over. And I've had a number of my tortoises that have been turned over. I try to check them at the height of the sun. I know pretty much when there's full sun in my pens, and when the time is, they could die of overheating easily if they were turned over right in the sun. And so those are things I have to, look out for when I check them each day, because they're fed just about every day. Once in a while, I may skip a day, but they'll push them over. And I've had some of my tortoise on their carapace spinning around, because they have my leopards have somewhat a high dome shell, and so when they get flipped over in their carapace, if it was a flatter shell, that was made them closer to the ground, they could get their limbs easier on the ground to try and flip over. But when they have a high dome shell, they're just spinning around in a circle. And I've had some that have made a groove, in the soil, spinning around. I've never had one of mine that has had a volvulus, and in the literature, the volvulus we've had only, I think we had 2 sea turtles with a volvulus, or maybe we had, and it was associated with plastic and ingestion. But I've never had one of my tortoises do that. Now, I had a tortoise that ruptured its uterus that died from yolk. Probably had yolk emboli, but I can't recall if that flipped over. It flipped over, and I righted it, and then several days later it died. I can't recall that. That would be the only other issue, maybe, of an animal that's ready to lay eggs, flipped over, and trying to exert itself, just ruptures, has yolk peritonitis. But I've only had one turtle, one of my leopard tortoises that did that. But I've had a number of them that flipped over and spun around for a while, and so. But I haven't seen a volvulus, or there are other changes in the GI tract. There are torsions and intussusceptions. I've seen several intussusceptions and sea turtles tied to monofilament, of ingesting monofilament. I once had a sea turtle that had part of the monofilament out of its mouth and out of its cloaca. It extended the whole length of the GI tract. And then I've had several with intussusceptions, where they get what is called accordion, where the gut gets, like an accordion, gets folded, just stacked up, and dying of that. But those are generally from foreign bodies.
I always wonder, because myself and Wyatt and some of the other hosts on the show all participate in a lot of mark recapture research in Florida and beyond, for where we're on a day-to-day basis going through hundreds of turtles and moving them around to pit tag them, and I always wonder about just the sheer magnitude, how many that we're potentially causing issues for like that. But it's good to hear that it seems to be a rare thing.
Yeah, I from my experience, it is. But you'd have to talk to, like, for instance, I've never asked that with Christine Berry. She would be. She has really good observational skills, especially when it comes to health-related issues. And she has They have their own pet dogs they've had over the years, and she's very, very fastidious with her pets. And that's probably the same, the way she's looked at illness, health problems in her tortoises, that a lot of biologists, at least in previous generations, didn't consider that as an issue. The younger group now, disease is on the forefront of conservation. If you look at I just saw a paper, it's coming out, I think, out of Brazil, that has to do with, I think, conservation of certain endangered reptiles, and they're really, disease is on everyone's list as an issue. And I mentioned, get back to the hemogregorines. That is a group I've seen both. I mean, I've seen a lot, especially in eastern colubrid snake and water snakes and garter snakes and so on. And I've never seen an animal that I consider that as the cause of death. And I think it's very common. And then you can somewhat separate out captive wild versus captive animals, because I've never seen any of those, and they generally need to go through another host in the wild. So you just don't see them in captive animals at all.
That's very interesting to hear that. Another question related to that one too is for pit tags, in terms of injuries that can be sustained. Have you seen anything that's abnormal after a pit tag insertion?
Not that but I don't. Again, I just don't do a lot. We pit tag animals that would come to the clinic or for some zoos, but not in the field in numbers. We have seen. I did a questionnaire a number of years ago. People working primarily with snakes, and had to do both with radio transmitters and with pit tags. And one thing, radio transmitters for the most part in Chelonians are on their shell, or are sealed to their shell. In snakes, they're put inside. They're put internally. And one thing I think that was, especially with transmitters, is the width of the transmitter. I think that to me hasn't been worked out. What is I think I've seen some transmitters in animals that just are far too big and are affecting the intestinal tract and the amount of digesta that can be in the tract where the transmitter is. And so I tend to avoid putting in if it's more than half the width of the animal. I just use that as a crude, guesstimate. But you have to be considering the width of those transmitters. Tags, there are a number of papers. There's quite a few papers now showing migration of pit tags. So they're capable of migrating. I think that the biggest thing is the loss of the tag can maybe lost, or the site. I mean, it may not have good site fidelity in all animals. But I don't know of any real problems with tags in turtles. There probably is someone that maybe has had a really bad migration, but I think the people try to standardize that as well as in terms of, say, site. What is the preferred site for use? I'm just saying rhetorically. You'd have to see how much variance is there from study site to study site, or most studies now pretty uniform on where they're putting pit tags. But migration to me is the big issue.
Okay, that's interesting. Yeah. So something else too that's interesting to me personally is the cancer prevalence in turtles. I'm curious, do you see it less frequently than you would expect? What's in your experience dealing with cancers in intestines?
Well, it's much more, except for if you take out fibropapilloma out of sea turtles, it's very sporadic cases here and there. And so if you look at crocodilians, very few to no cases. And so in reptiles as a group, most of the cases are seen in lizards and snakes, but of course, they're 90% of the population of reptiles.
Yeah, really.
But still, crocodilians appear to have the fewest cases. And you're dealing with 25 species, 23 species, or 25 species. They're very conservative, have not changed a lot over time, and they do just infrequently have tumors. I would say in turtles, tortoises, maybe reproductive tumors, and several I think in the literature. Papillomas have been seen in a number of different. I've seen reports in snapping turtles and other turtles, but where no virus has been found, where there's no evidence for a virus, but have a skin tumor. Trying to think of what other body system. You get this anyway. Again, you remove fibropapillomas and papillomas, remove those from chelonians, and then you have a scattering, I think, of cases. We have in our 2-volume set. There's a chapter on neoplasia, and it does, I think, a fairly good job. You can take a look at. There's probably a table in that chapter that lists all the different chelonians and the cases of neoplasia in them. But in terms of just cancer, metastatic, not that common.
Yeah, it's really interesting thinking about the sort of molecular mechanisms that control that. It seems like the whole Peto's paradox situation and larger bodied animals, they still don't get it at a frequency you would expect. So there's got to be something underpinning that.
Well, they're a very conservative group of animals that's been successful. They've been around 160 million or whatever number of years. And of course, we don't know what they were like physiologically in these past years. But and the crocodilians too are very conservative. They have not changed a lot. So they have a certain stability to their genetic architecture. You get into lizards and snakes, you see incredible diversity of body form and size and so on. It's just pretty remarkable. And so you're dealing with a much, higher evolving, the animals that are evolving, I think, quicker over time in greater diversity and greater numbers of species. And you tend to then see more tumors being described. But you would have to look at, the composition of collections and what is the percentage roughly of people that have turtles and tortoises. A lot of people have turtles and tortoises do not necessarily like snakes or other reptiles that much. I'm very, very focused on that group of animals.
Right. Yeah, it is sort of its own sort of world. I feel like a lot of reptile captive keeping is kind of separated into different sort of groups. But yeah, it's maybe in your experience, more turtles are kind of more of its own thing.
There's probably more in tumors and that incident, individual reports here and there. For instance, the London Zoo has historically maintained very detailed records on their collection, animals that are being necropsied every year, and what these animals have had. And so that's really a really good site of information. That chapter on neoplasia probably has some of that literature in it. Getting a real grasp on the European literature, especially like in the German literature, is having friends over there to do searches and get copies of certain papers, which are hard to get. But there may be more out there with turtles and tumors. Certainly, crocodilians have the least number of that I know of all the reptiles. And again, they have this, the smallest group of having 20, say 5 species. Very, very conservative group. But there's a mycoplasma identified in alligators that killed quite a few animals at one of the places that we work at. West Nile virus issue in Nile. So there are pathogens that get into them, but tumors, none. Crocodilians.
Yeah, interesting. And it's something else too, in terms of like shell repair with turtles. What's your preferred method for that? And are there any particular piece of advice that may seem counterintuitive, but that people should know in the event that they get a turtle with a shell fracture?
The big thing is not sealing the wound completely over with any kind of replacement material, epoxy or whatever. Those lesions really need to granulate, what we call granulation. They need to granulate in. We often use wet-dry bandages, and we've used, there's a paper by one of our residents, Maud LaFortune, who published a paper on vacuum-assisted healing of the shell of turtles that we've used quite a bit, where you put bandaging on it and use a vacuum system to draw out fluids from that, and then the animals have to get replacement fluids. I mean, that shell is, depending on how large the damage is, there's a lot of fluid that can be lost through a very big wound. So that's why we use these, wet-dry bandages.
Okay, yeah, and then sort of one last thing, and then we can kind of go into just our closing piece. But something my grandpa's a human physician, and he does a lot of work with different like hyperbaric treatments and laser therapies. I'm curious what the extent of knowledge for reptiles and exotics. What kind of research has been done in that area, and how effective are those things?
Well, a lot of it, clinical work that is done with mostly with laser, hyperbaric. I know some people have used that with certain types of wounds, but I can't give you any kind of idea of numbers, how many cases out there that people have used hyperbaric chambers. But I know of people that have used them for, especially with some cutaneous, really bad cutaneous lesions. Laser therapy has been used in terms of surgical lasers for removal of tumors. Very popular with green turtles, and the other sea turtles. They have fibropapillomas. They're primarily the people that are doing large numbers of these turtles, like the Turtle Hospital in Marathon, and they've been using laser surgery for a long time. They have a previous veterinarian of theirs, Dr. Doug Mader, I think, introduced them to using lasers. And he's given workshops, I think, at the ARAV at their annual meeting. I think they've had labs on use of lasers for removing tumors, cutaneous tumors. And I think there are other facilities. There are maybe a dozen, maybe 20 different rehab facilities in Florida. Somewhere in that, maybe 10 to 20 sea turtle facilities. And I think laser surgery has become a little bit more common. And you'll see it's also a reflection of what people are using in private practice.
Yeah, that's interesting. I've seen it. I've been to the Jekyll Island Center, and I've seen them doing that sort of thing. and some other turtle hospitals like the Karen Beasley Center and such.
Yeah. Dr. Terry Norton, who's at Jekyll Island, he was one of our residents, and actually was with me on the very first fibropapilloma case we worked on in 1987, which was at the Turtle Hospital. Before it became a turtle hospital, it was a motel called Hidden Harbor Motel that eventually got turned into the turtle. Then a building next to the motel was bought out and turned into their clinic. And then the owner started building, I put in lots of big tanks for the turtles. And then one of the hurricanes wiped out the motel, and they decided not to reopen as a motel, but just to keep the rooms as guest rooms for people coming there working with turtles. And so the owner of the turtle hospital put a lot of private money into rehab on these animals. All the turtles that come in with tumors get MRI'd when they come in to check for internal sites of tumor presence of tumors internally, and that is one of the criteria used for euthanasia if they have internal tumors, because I don't think anyone has seen a reversal of that. Whereas some turtles with the skin tumors will get over them. But once they go internal, we don't have any evidence of those ever resolving.
Right. That's a tough situation. I recently had to euthanize a box turtle that had been hit on the road. The skull was completely fractured. The eyes were popped out, but it still had some level of sensitivity. But that having to do that consistently that's a challenging thing.
What we do with small reptiles and amphibians, and there's a paper published on this, we cool them down in a refrigerator when we don't have access to other types of euthanasia drugs. But if they're small, they can be cooled down and then put in the freezer. Yep. And I think there's good evidence that they're not at that point, once they're cooled down to a certain point, at least looking at conduction of axons, that there is essentially no conduction, just above freezing in their brain, and then they can be frozen. But there's a paper in a biological science journal. I've co-authored that with several friends, so when you have nothing else and an animal is in that kind of state, then we will freeze it.
Right.
But it needs to be fairly small.
Yeah, right. The pain tolerance is something else. I think like the moral dilemma behind it is, does their pain tolerance, the HPA axis and that sort of thing, it functions differently in reptiles. So it's like if it is suffering to an extent where a human would be in a case, it may just be better to euthanize the human. For a reptile, is it better to leave it alive if it's not feeling the pain? What do you think about that? I mean, do you think they conduct pain similar to us, or?
No, there's evidence of pain in them. That's everything comes down to what is the best thing to do for the animal. In the situation that you have an animal that has fractured shell and his eyes are processed, and basically the heart is beating, and their hearts. I mean, turtles have a heart that's very myogenic. They often will beat for long periods of time where the animal is really clinically dead, and that's why their heart has been used so much in physiology laboratories, looking at the effects of various drugs on stroke volume and heart rate and so on. Turtle hearts have been used classically in past years, now not so much. But they have a very myogenic heart. Ours is much more neurogenic. And so the heart will continue beating for a long time that the animal is otherwise really clinically dead. Pain, yeah, they feel pain, but we don't know what analgesics. There's nothing that probably works uniformly across all groups of animals. And in actuality, only a handful have been really studied. Yet, there's a real concern about pain and what they're feeling. And so, we balance things out. We look at this. We try to do the best we can to keep pain as minimal as we can. But for instance, here I am at home dealing with, we have invasive Cuban tree frogs on our property. And then Anola segrii, they're all over the place, Bahamian, Cuban brown anole. And so with Cuban tree frogs, I cool them down and I freeze them. And it's hard to keep up with. They're feeding on our native frogs. So they're problematic. But I don't disregard totally their life. I try to do it as best I can. And I keep some MS-22 around, and there's a paper published on the use of that for euthanasia, and that you don't necessarily. I don't think you need to have a veterinary license to. I think it's available, being sold without a script. But MS-222 works fairly well for euthanasia. But then it's having it available. What do you have available? I have friends that, having barbiturates is not easy to have, even as a research. I'm not licensed as a veterinarian in the state of Florida. I was always operating through the University of Florida, had a license for the clinicians there that didn't have a state license. But then I retired, and I'm not licensed, and to get to do certain things, I have to go through friends to help me, or through the Zoo Med service that I bring animals to for treatment. So that is problematic, getting certain drugs. I tend to avoid barbiturates because whatever tissue they come in contact with generally makes the tissue not good for histopathology. It causes a lot of local damage wherever you inject that drug. So you need to know the pluses and minuses of the drugs that you're using and why, and what are you trying to do a study on the animal after it's dead. And you need the tissues for histopathology or for physiology, so that will influence what you're using. So there are a bunch of things that go into selection. And certainly as a veterinarian, I have my preferences, and I know how to, a couple of miles from the vet school, if I find an animal on the road that needs to be euthanized, I'll bring it over to school and submit it for that.
Yeah, that makes sense. That's the morality behind it is only part of the thing that factors into it. Obviously, that's something you want to make sure is there, but then, yeah, do you need the tissue for later, and there's other considerations that makes sense.
And any of these tissues if we have a wildlife species that gets necropsied and then frozen, you cannot now to even now in clinics, we need what are called IUCUCs. They're institutional animal care committees that evaluate all the proposals that are submitted. All research proposals that deal with either tissues or the live animal itself have to be approved by this committee and given what's called an IUCUC number. And that's essential. And now these committees, the people on these committees often don't have experience with reptiles necessarily that are reviewing these proposals. So then they ask for outside people who have special training. And I've looked at quite a few of these IUCUCs to make comment on how the reptiles are being kept or handled or how they're euthanized. And so University of Florida has a very detailed, a committee that really looks at proposals and details. But sometimes they go overboard, where they're requesting things that we just don't know what the answer is. And so there's an old saying: the more you know, the more you wish you didn't know.
Yeah,
it was much easier years ago to get a proposal, approved than it is today if it's dealing with live animals or their tissues. Just the way it is.
Right.
And
yeah.
certain people hate these iacucks, and other people love them.
Yeah, I took a class with someone in the fall semester who does a lot of work with insects, and I guess that's not really a problem. But the times he's had to work on any sort of vertebrates or I guess mammals, reptiles, fish, that sort of thing, it becomes. He said that there's some very interesting discussions that happen, and a lot of times it ends up being kind of frustrating down the line.
Well, the octopus, the cephalopods are a particular problem.
Okay, yeah,
and they're still yet to be worked out what is satisfactory for them. There is a cephalopod. There's a discussion group on Facebook, and that whole question of what they feel and they're very intelligent animals in a lot of different ways. And so I have friends that are very sensitive to this, with cephalopods.
Right. All right. Well, so we can just kind of wrap things up. This has been great, but I'm curious, just as sort of closing questions in terms of your career, what the most interesting case you've seen with a turtle or tortoise was, and maybe what the hardest operation you had to perform on a turtle or tortoise or in general was.
I'm not a surgeon, so I do some very basic surgery, like put in transmitters and certain. I know the anatomy of these animals very well, and that's really essential because I started out as a biologist first, and then wound up going to dual enrollment in vet school and graduate and graduate school. And over the years, I know where my limitations are surgically, and I've had friends that have been now service, colleagues that are boarded in zoo medicine and also boarded in surgery. And so we've had some very gifted people here. And if it's anything very complicated, we tend to go to our surgeons. Who have always uniformly done a really neat job. And one example is I did a fair amount of work with ostriches, and foreign bodies are real common, and also commonly see them in certain reptiles of swallowing foreign bodies and have to remove foreign bodies. But we had this ostrich that's it's radiograph. Its proventriculus was just packed with screws and nails and every metal object you can think of. And we wound up with a friend who is a surgeon, and I assisted on it of doing this proventriculotomy, open up the proventriculus, pulling out all of these metal objects and lining them up on a sheet of paper. Ostriches will eat anything. And if you have ostriches, and to a certain degree tortoises, we've had some interesting foreign bodies, is having a metal detector and making sure wherever you're keeping these animals is pretty, clean of metal objects that they potentially could ingest.
Yeah, go ahead.
No, and the kinds of routine surgeries generally, hit by car injuries of some that are really not repairable, and some pretty amazed at how animals repair. Shock bites on sea turtles, having a whole limb and a portion of the shell taken out, and yet the animal has healed. And it's pretty amazing the kinds of healing that these animals are capable of doing. But there are certain things that they're just not going to heal from. For instance, transected back injuries in tortoises. If we have a hit by car tortoise, or even box turtles, they have big bladders, sizable bladders. If they have a transected area in their lumbar, in their hind part of their spinal cord, they lose then control of their bladder and their hind limbs, and they wind up rupturing their bladder. So if we have an animal with a tortoise that comes in with a transection of the lumbar, in the lumbar area, what would be called the lumbar area, we generally euthanize them. And sea turtles, though, have a much smaller bladder, and they can stand transected cords. They can live their whole life out with a transected cord, lower cord. So again, you have to know your species and what it's capable of doing and not doing. But they are capable of some incredible repair. But I know of someone who claims to have seen a tortoise, I think maybe by a lawnmower, a transected cord that healed. And I just don't believe that's possible. But someone else will have to prove it.
Misdiagnosis or something similar.
Yeah.
But yeah. Well, that's the whole the metal objects and just foreign bodies in enclosures is I've seen that plenty of times in people's captive collections. Some things where it's like this could really be an issue. So it's good to hear that.
We had an interesting case was we received the Galapagos tortoise in the 90s from Isabella. It came from the Galapagos. Someone there was a big fire, and this one tortoise got a rope put around the hind leg, and the limb became necrotic. And we got special permits from Fish and Wildlife Service and from Ecuador of sending the tortoise here and for treatment, which we had to remove the limb, and we rigged up, we epoxied a structure to underneath the shell, right by the plastron, the very caudal plastron, just to elevate the animal off the ground so it wasn't just dragging its plastron while it walked. And that helped quite a bit. And we had that tortoise for several months, and we wound up taking it back to Galapagos.
Wow.
And return it to Isabella, which was a big affair to do that. And we had people taking photographs of the animal, and we were met at flying into Ecuador by the U.S. ambassador to Ecuador, who his daughter was interested in vet school, and he and her wound up going with us back to Galapagos. And then this boat ride to Isabella was a nightmare. It was 11 hours on this, motorized sailboat, which the motor broke down, and we're just coasting. I mean, I got so sick from 11 hours on this up and down boat, and we're sleeping in a bunk that was right next to the diesel engine, and it was one of the worst experiences I ever had. And what was worse was going back to Santa Cruz, because once I knew what it was like, it was a nightmare. It took me a whole day just to stabilize from the vertigo. It's hard to describe unless you experienced it.
That's yeah, I guess you can't really anticipate how long it's going to take. So so you were going from Santa Cruz to Isabella, and it took 11 and a half hours. That's
11 hours, yeah.
And that's just because it wouldn't take nearly that long. I mean, I'm assuming.
But it was still a motorized boat that's not going really fast. But it was the only boat that they could get it was Charles Darwin Center had set up this made all the arrangements, and so we went with the head biologist there at the time. And then she's telling us all these horror stories of boats breaking down at sea and things going wrong and disasters, which were really neat to listen to at night when you're really seasick.
Yeah, in the boat, right? Yeah.
But yeah, it would have been 7 hours instead of 11 or something. But it was more than I needed.
Yeah. Wow. That's any other like field adventure, just crazy experiences in the field, or is that the craziest
Well,
one?
there's one I'm writing up. It has to do with collecting these land iguanas in the Bahamas, Cyclura riley, and which is it's just located now on a few Ks off of the coast of San Salvador, one of the islands in the Bahamas. But that's a story I'm writing. A friend is doing a book on things that go wrong in the field or interesting, funny stories in the field. And so he's putting a collection of different stories together. So I'm doing one on this, going to collect these iguanas, which almost turned into another disaster trip. They're probably the ones that you remember the most, the ones that almost kill you.
When that I hope I see that when it comes out, because that's I always like that kind of stuff. It's just part of the adventure. That'll be a fun read.
I'll let you know. It's being done by Harvey Lillywhite, who's top knot, and he's retired also now, but reptile physiologist who's done a lot on cardiovascular system of snakes. Primarily works with squamates, but has done a lot of field work, especially sea snakes. He's spent quite a bit of time off of Costa Rica and Australia with some pretty big grants to study basically how sea snakes operate in the field.
That's awesome. Yeah, that sounds like a fun thing. So just our sort of concluding question we have is just in terms of pieces of advice for those looking to make turtle, tortoise, reptile, exotic medicine sort of a career. What's one piece of advice that you would have, or more, that you think someone sort of upcoming should hear?
Well, there are people interested in this field than ever before because of professional organizations such as the Association of Reptile and Amphibian Veterinarians. And so at least today we have a fairly good idea of the expertise around the country, and there's a lot of expertise. And you can see it by you can go to proceedings of ARAV, and they have proceedings online for members of the organization. Very good. I encourage anyone who's really interested in these animals to become a member. I can't remember what the annual membership is. For students, generally get a cut in the price compared to graduate veterinarians. So that's really good to see, and to see who the major people are in the field. Not necessarily all the people who write are necessarily the top. A lot of clinicians don't like writing, but you get a really good idea of who's out there and what they're doing. And if you're an undergraduate, you want to go and do externships. You want to go and get as much experience as you can, whether it's in the field, working under someone who is in the field, working with populations of these animals, or someone who has a really good practice. And there are several veterinarians that have high-end practices that are primarily on exotics, not necessarily all reptiles, but including other exotics too. It's really hard to make a living. There are some doing it, but it's not easy making a living just doing reptile amphibian veterinary medicine. There are fewer practices that do, but they tend to be, near big cities, big metropolitan areas, or universities. There are more positions in universities today than before, but still not as many as you would hope for those that are interested in going into this field. Many of the people in the field are doing it part-time, are in a practice that sees exotics, but is also doing a lot of domestic animal work.
Right. Okay.
So that experience is really critical.
Yeah.
And to compete and there are internships and residencies in zoo medicine or exotic animal medicine, avian medicine, reptile medicine. There are. And so you want to go to a clinic and get experience where there's a good volume of animals being seen. But there's more information today, more clinics that are doing some level of exotics now today than ever before. Field work is different than working with animals in a clinical setting. And so field work often entails epidemiological studies, and quite a bit different than working on clinical cases. So that's something to sort out. Do you want to work on conservation issues and that relate to animals in the field, or are you more interested in the pet industry and the pet trade? Very different.
Right. Those are two different areas. I think that's good advice in terms of getting experience, and just in terms of getting you to the next level is participate and developing even sort of mentor student relationships with other people in the field already is a great thing. So
many of our residents, past residents, I can't speak of the last group of them, but had 3 to 5 years of post-veterinary school experience before they were selected in the residency.
That's wow, that's interesting. That's it takes a lot of experience. Okay,
because we want, for us, and as far as a resident is concerned, interns are a little bit different because they're generally fresh out of school. But for a residency, you want a person, we want to select a person that comes in that knows how to work with clients, and has had certain very basic skills. Have to be decent surgeons, decent in internal medicine, have gone through internships in those fields, or anesthesia. We've had several residents that have done residencies in anesthesia before applying to our program. So having the real basic skills of veterinary medicine, which you then can apply to reptiles or amphibians, are real important.
Right, that makes sense. It's good to know, and it also says something for, like you said, the good working skills and sort of communication skills. That's something that's important in the veterinary field. So
it's critical. Whatever field you go into, unless you're working, you could be a pathologist working alone, or a radiologist now who's reading out MRIs for private practice, and work out of home and be your own person. But when you're working with a group of people, those communication skills are essential. And some people have them, and other people don't.
Right. All right. Well, I think that's sort of, unless you have anything else that you want to say, we can sort of wrap things up.
No, if once you go through and listen to the podcast and you have any questions, or there seems to be any conflict of what I said, or said once, or maybe repeated again, but gave a little different answer maybe. So if you have any questions, contact me and I'll sort them out. I just want to make sure we get the best information out there, and as few mistakes as possible.
Yeah, that sounds good. It'll be a while before it's available publicly, and I will definitely keep in touch about that. At the end of all of them too, we like to, I forgot to mention this to you, but we like to do a little like turtle or reptile related trivia for obscure facts. But we can do this. We don't need to do it. You can just ask us questions, or we can ask you some questions, however you want to do that. And if you've got to go, then I understand that too. But it's just kind of a fun way to bring in obscure facts that are hard to put anywhere else.
that are true.
Yeah. Well, I mean, we try for the best accuracy. We've had like 50 guests at this point, so I'm sure some of the stuff that's been used as trivia questions is a bit maybe outdated or inaccurate. But I don't know if you've got a few questions off the top of your head you want to ask us, or we can throw some your way.
It was just an interesting saying, which I just it comes from Don Quixote, and something I guess I read it long ago, but there's a statement in there that that Don Quixote is asking Sancho, and he goes, Sancho, you know what the greatest enemy or the greatest enemy of the truth are facts, and that the truth can vary, but the facts do not.
There you go.
Facts are facts. And so it's just an interesting comment that he makes to, and this is written in the 1500s, that facts are the greatest enemy of the truth.
Yeah. From a sort of empirical, scientific perspective, that's a real thing. But yeah, for people that understand that quote, it makes a lot of sense. And I also feel like there's a lot of situations where the quote may not, it doesn't fully hit home for certain areas. That definitely with some of the COVID and certain things was highlighted. But that's something else. But yeah, I definitely I think we appreciate that quote for sure, and it's a lot to kind of think about. But yeah, the wisdom behind it. In a few of my Spanish classes, we would go through and analyze that text, and that it's incredible that was written so long ago.
Oh, it is. It's very remarkable. I need to go back and actually reread it at this stage of my life, where the first time I just had to read it for class.
Right. Yeah.
Different now.
Right.
But if you have any questions, I mean, if you want, we can set up another time, or we can do a few things right now.
Yeah, I mean, I'm in terms of the podcast, I think we're good to go. And for that.
Yeah, because I see it's 2:15. I have to get someone's picking up a group of snakes for me, so I have to get them ready.
All right. Well, that sounds good. I'll keep in touch about this, and I'm sure I'll reach out in the future for other things. So yeah, for sure.
Glad to help as I can.
Yes, thank you. Thanks for coming on. For all the listeners, this has been...
The other thing, which is most important, but having a library, a really good library, and one thing I noted, which is really interesting, with some of the interviews, especially from cultural things to COVID and on the news of people now broadcasting, being interviewed. So, I mean, routinely from home on Zoom or whatever is being used, and that you often see behind people that are being interviewed, and as experts in a field, their library. And now some people have just incredible libraries, that libraries and books, and in the old days it was reprints, now it's PDFs. But in the old days it was your reprint collection, which I still maintain. One of the few things I really kept is my reprint collection. And those things have tremendous value. They have a certain value. It's hard to express unless you have them. Even if it's a book that you pick up once every 10 years, if you want that information, The closer at hand it is, the better it is. And so to me, libraries will always be important. But the generation now is so into PDFs that I think the younger people have almost no library other than PDFs.
The digital library. Wyatt made a comment about your library earlier. Actually, that's funny that you bring that up. About just the fact that you had stuff there.
Nice. Well, it was so important in graduate school to have your library at hand rather than have to run to a library or get it on interlibrary loan. And there is still today, one of the benefits of being retired is I have access to the UF library system. And if our library doesn't have it, I'll tell you one library that's really almost inversely, our library goes to University of Illinois Library. It must have just an excellent library. But there are a lot of still papers that are not that easy to get access. And then I have friends over in Europe who I'll get certain papers there that are very difficult to get at. Plus, then I have to get a certain amount of translation done. So, but as you build up a network of friends around the world, then you have a network of people who can help you find certain literature that is not easy to get.
Right. Yeah, that's important. That the whole social skills aspect too. That's another thing. And that something about having a physical copy of a book is pleasing.
I still like that better than a PDF, or I like it better, not a PDF. If I print it out, fine. But I don't like, for instance, now journals are going to reviewing papers online, not getting a hard copy or a book, getting a book for a review, and they want to give you the digital copy of the book. And boy, I cannot review a book on a digital copy. I refuse to do that. I need a hard copy. Hard copies are much better in certain ways.
Right. Yeah, for saving purposes and marking up, it can be a challenge. Well, okay. I think we'll let you get to dealing with your snakes, and we'll keep in touch. But for everyone out there, this has been episode 38. A really thorough and interesting discussion. Thank you so much for coming on, Dr. Jacobson.
No, glad to. And if you have questions, just send me a message.
Definitely. All right. Thank you. Yep.
All right. Take care.
Yep. You too. Have a good day.
All right. Bye.
Bye. One sec.